Good morning, everyone. Chef AJ here, your host of the GI Health Summit, Day 2. Thank you so much for being here, and thank you so much for all the wonderful comments you're making on the Summit page and helping each other, and also the wonderful emails we have received, and for supporting our work. So many of you have bought the package and are using your Buddy Pass, so we thank you so very much. Remember, this summit is about you and finding the best ways to not just heal from any GI problems you might currently have, but just to optimize your gut health. Because what we're learning from all these people who are experts in their field, pioneers, researchers, is that gut health is related to overall health, and you can't have one without the other. Like that song, Love and Marriage, you really can't. And so hopefully you're going to learn that lifestyle matters, what you eat matters, good habits, sleep, exercise. So today we're going to talk about the new frontier of health. You know, yesterday we talked about the causes and consequences of gut problems, and we kicked off the day with Dr. Mark Pimentel, who talked about how these problems are not in your head, although there probably are some doctors and clinicians and people who believe they are. But the new frontier of health really is this gut-brain connection, because we've learned that the gut and the brain talk to each other. Actually, all parts of the body talk to each other, but this is especially important in gut health. And today, believe it or not, we have 7 speakers, but only 5 talks, and one of them is actually quite short, so we'll still get you out on time. And please remember that it's not video when it's delivered live. We just can't deliver video live. But as soon as the summit ends for the day, you have about 20 hours to rewatch any videos, and then you can also access the video. So please just enjoy the audio during this part. So our first speaker is Dr. Lynn Chang, and she'll be followed by Dr. Uma Naidu, followed by Dr. Kirsten Tillage, and then a trio of doctors who work together, Dr. Lawson, Dr. Del Pozo, and Dr. Latifat. And we'll end the day with Emran Meyer. I actually have the privilege of knowing Dr. Lynn Chang because she was one of my doctors when I lived in Los Angeles, and I'll tell you that story after her wonderful interview. I know you're going to love her. The thing that I hope will really come through, and that you might have to watch the video to see, these doctors care so much about what they're doing. And even if they don't have the problem themselves, they're such deeply caring, kind people. It's just like, you just want to have a cup of coffee with them. Well, I don't drink coffee, but you want to have a cup of green juice with them. And they're just wonderful people. And they're just highly intelligent and highly driven to really solve your GI problems, because they know that people with gut problems sometimes suffer for years. I suffered for over 50 years. I'm learning from this summit that the average IBS patient has suffered for 17 years. But there is something you can do, and I know you're going to glean the knowledge from this summit. And hopefully you did what I said yesterday and took one tip from each of the doctors and started to implement it in your life. Remember, you don't want to go 100% overnight, because when you add fiber to the standard American diet, you can get some uncomfortable symptoms. Low and slow is the key. So let's kick off the day with Dr. Lynn Chang. Dr. Chang, and welcome to the GI Health Summit. Thank you so much for being here.
Yeah, thank you for inviting me.
It is my pleasure. So Dr. Chang, so many people suffer from functional GI disorders. Could you please talk a little bit about what they are, why this is, and most importantly, what we might be able to do about it?
Yeah, you're right. Functional GI disorders are the most common conditions that are diagnosed in primary care practices as well as GI practices, other than, gastroesophageal reflux disease or GERD. But they're disorders where patients have these real symptoms, and they're symptom-based, and they can range from symptoms in the esophagus all the way down to the rectum. So they have different conditions and names according to where they're localized. So irritable bowel syndrome, or IBS, is one of the most common ones, but it means that the physiology, or the way the gut functions, is not normal, but there's no structural or anatomic abnormality that you can see that you can readily diagnose on an imaging study or an endoscopy, but the real symptoms. So that's why we call it functional GI disorders, because there's a disruption in the function. However, more recently, these disorders are now being called disorders of gut-brain interaction because there's a lot of scientific evidence to show that these conditions are due to this altered communication between the brain and the gut and leads to changes in gut function that can affect the sensitivity of the bowel, the motility of the bowel, the microbiome. So it's multifactorial.
Well, what are some of the gut brain mechanisms that underlie IBS? And maybe just in case our viewers don't know, what is IBS? How does somebody get diagnosed with IBS?
Yeah, so if we're going to talk about IBS, and can remind me just in case I forget to talk about the brain-gut interactions and communication. So IBS, or irritable bowel syndrome, is generally very well known now. I don't know if everybody always understands exactly what it is, but it's basically a chronic or recurrent condition where patients have abdominal pain that's associated or linked to diarrhea and or constipation. So some people have diarrhea or constipation without pain, or they have pain without diarrhea or constipation, but it's really the link of the two, that when you have pain, you have more diarrhea, you have pain, you have more constipation, or you go back and forth.
That's got to be very frustrating.
Yeah, it is.
What percentage of people suffer from this? And is it primarily a disease of women over men or certain ages, or is it an equal opportunity destroyer?
That's a good question. Well, it depends on what symptom-based criteria you use. So we have right now, because there's no diagnostic marker test to diagnose all of IBS reliably, we have to use symptom criteria. And depending on what symptom criteria you use, that changes the prevalence. Overall, it's probably about 10 to 15%. It's a worldwide condition, so you see it in all different parts of the world. And there's this huge global epidemiology project that the Rome Foundation did that measured IBS in many places in the world. If you use more of the standard criteria that we're using now, then it drops to about 5% prevalence, but it's somewhere along that line, 5 to 10, 11%. I don't know if you asked me another specific question.
Yeah.
Oh, so there's different types of IBS in the sense of bowel habits. So like I said before, there's IBS with constipation predominantly, IBS with diarrhea, and IBS mixed, which means you go back and forth between diarrhea and constipation. In the constipation subtype, there's more women that get affected with it than men. For the diarrhea type, there's a little bit more men than women. If you look at IBS, so one other thing I should say is that I would say the majority of individuals with IBS symptoms do not seek healthcare. So if you look at the general population, it's probably a little bit more women to men. If you look at the healthcare seeking population, you'll see more women presenting at doctor's office or other clinicians compared to men. So women are more likely to healthcare seek, but they definitely are more likely to have constipation than men are.
I think women are probably more likely to go to the doctor than men for anything.
Exactly.
Yeah, that's because we're smarter, I think. Well, since it's not an infectious disease, how do people acquire this disease? I mean, are certain people predisposed to this, and how can we avoid it? I think would be a better question, because once you have it, it can be a battle for many years.
I think that's a really key question. There's multiple risk factors for IBS. One of them is infection. It's not an infectious disorder, but there's a subgroup of patients with IBS have something called post-infection IBS, meaning they never had any IBS symptoms. They get a gastroenteritis, for example, food poisoning. The infection clears, but now they have ongoing symptoms that meet the criteria for IBS. So that's called post-infection IBS. And many of these patients early on, the physician thinks that the infection is still going on. So they get treated with multiple courses of antibiotics. And really, the fact is the infection is gone, but now there's a dysregulation, disturbance in their bowel function, and they have IBS. That's about 10%, or it's a subgroup of IBS patients. Then there's other risk factors. There's a genetic predisposition, so it runs in families. Whether some of that, there's definitely evidence by twin studies that there's a genetic predisposition. There's also probably some learned behavior, like familial clustering studies show. But then there's something that I study, which is stressful life events. So there's definitely a lot of data that experiencing some early life adversity in childhood, that it increases your risk for chronic illnesses. It's not just IBS, it's lung disease, heart disease, obesity, substance abuse. It increases the risk or the vulnerability to get these. Now, that's more of the exception than the rule. A lot of people have early life adversity and they don't get this, but it just increases your risk because when we're growing up, that's the time a lot of our adaptive systems, our immune system, our cardiovascular, our GI tract, they're all maturing and functioning and developing resilience. But if there's some disturbance from really a more stressful, usually prolonged stressful event, for example, abuse, it doesn't allow, the body has to be in this stress responsive state, and it doesn't likely allow good maturation of the adaptive systems. And, and something you'll learn when you talk to Dr. Meyer, that the brain develops, and it matures, it takes 25 years. So that increases someone's risk at IBS, usually about twofold. And the more burden you have, the more of these events, it's a graded relationship, the higher your risk is. Now, adults, when they go through stressful life events as well, they can also be more at risk for developing IBS or have a greater symptom severity. But it's not all early adverse life events. For example, if your parents get divorced, that's not necessarily related to increased IBS. It's more abuse, typically emotional, verbal abuse, sexual abuse, mental illness in the parent. And then if a parent is incarcerated or someone in the household is incarcerated, those are risk factors for IBS.
Wow. So what are the effects of chronic stress on the gut-brain axis?
Yeah, most of this has been studied more in animals than in humans. We definitely know that patient surveys show that they think that stress is one of the causes of IBS, and it's also a trigger. And if you look at scientific data, stress can do a lot of things. So just a normal stress response in our guts is that you could have diarrhea or frequent bowel movements, but in the upper gut, you can have nausea and vomiting. So you've probably heard those stories when there's something a performance or a big game or something that's going to happen, someone vomits or they go multiple times to the bathroom, and it's the way that the body responds. And there's some mechanisms that explain that, but I always think of it's a way of getting toxins out from both ways. So that's kind of a same response that a lot of us can get when we're undergoing something that's more stressful. But long term, it could change the sensitivity of the bowel. It lowers your pain threshold, so you're going to feel more in your gut. It could change the motility of the bowel. It could make it go faster or slower. There's also evidence that the lining of the gut, like that late term leaky gut, which really means that's increased intestinal permeability. So the barrier function, the lining of the gut is more permeable. That can increase in stress. And then also stress can affect the way that the brain processes the information. It may increase the arousal or the attentiveness to sensations you feel in your body and doesn't allow engagement of these descending pain inhibitory pathways that try to dampen the pain. So if you're under something really acute stress, your body doesn't feel it. You probably heard some of those stories. Someone may get some injury and they didn't even realize that they broke their arm, until later on. That's acute stress response. But chronic stress gives you a different response. The sensitivity in your body is actually increased. You're more likely to have a chronic pain condition.
Wow. It's so true what you said about stage fright. I used to chef for a famous celebrity, and he would always vomit before he went on stage. And I thought, wow, this is interesting. So
a lot of us actually get that, but then we go back to our equilibrium state again. The problem for IBS patients and these other stress sensitive conditions is that you can't get back to your baseline equilibrium state. You stay in this dysregulated state, and Bruce McEwen called it allostatic load. You reach this certain threshold where now you have this more sustained dysregulation where you can now develop symptoms and you don't go back to your baseline state.
That makes perfect sense, because the people that I know that have it, they do suffer. You're right. It's almost like they can never get back to that ground zero. So we can't really control what's happened to us in the past. So how do we become resilient once we get IBS? How do we deal with the stress so that we can at least kind of keep things
at bay?
Well, one question you asked is what can decrease the risk? And unfortunately, we don't have that much data on protective factors. But one study that I did where we really looked at individuals who had early life adversity, that there was a question in the questionnaire that asked, did you confide in others at that time about that traumatic event? And the people that did confide in others, say a parent or someone close to them, it actually decreased their risk, even if they experience of IBS, even if they experience an early adverse life event. So it does tell you, I mean, I know it's very hard sometimes to do that, but of course a support system is important. But having resilience, which I know that's a term that everybody uses, but that really means the way you can, it means that you positively adapt to adversity or stress. And we've done studies in IBS to show that the resilience is lower in IBS patients. And the part of resilience, which has multiple components, that's decreased in IBS patients is the ability to bounce back. So, for example, so I tell my patients this, like they'll say, everybody got food poisoning, but they're all better and I'm not better. And it's usually because it just takes longer to recover than it would if you didn't have IBS. So that's something to remember so that they don't feel distraught that they're not going to get better. It just may take them longer to recover.
Wow. But it is possible to recover and build up your resiliency.
Yeah. I've looked a lot at these resilience programs, and, I think people are doing that for the homeless, elderly, and also trying to figure out maybe behavioral therapies that can increase resilience. So resilience hasn't been always looked at as a target, but I think it really should be. But the components of resilience, building resilience, is having empowerment, the person being empowered, having a skill set that they find is valuable, and having social support. Those are components that I always think about when I see a patient. Do they have that? I have to say that I will ask patients, who's your main support system? And do you know what they usually say?
No one.
Yeah, just themselves.
Oh.
Yeah, it's them. And I do think that having a support system is really important.
It sounds like it would be important for everything. But it sounds like building resilience in these tools, it's a lot more difficult than a doctor just writing you a prescription.
Definitely. I doubt there's a prescription or definitely for a medication that's going to build your resilience per se. However, I will say that there are medications that can start normalizing your gut to make it more resilient. And I always tell patients, we're going to try to give a little buffer so that you can eat more. You can diversify your diet, or you can be exposed to certain stimuli where it's not going to trigger a flare.
Right. Back in the day, didn't they consider IBS patients as just to be in their head, that it wasn't even a real disease?
Oh, yes, definitely. And I definitely think some people may still think that. It's interesting because I think we grow up in a society to not believe something unless you could visually see it, even though every day we experience emotions that you can't see, like love. You can't actually, there's no anatomic, confirmation of that. But, I think we've all experienced that our bodies can respond physically in a way, even though we can't actually see it, but then we recover and we go to our baseline state. So then we kind of forget about it. And patients with these chronic conditions, they can't.
Yeah. Are there specific underlying mechanisms of the gut-brain axis that underlie IBS?
Yeah. So if you're going to think about pain, that is there are pathways from the gut to the brain to the gut that are involved in pain. And we have pain facilitatory pathways and we have pain inhibitory pathways. And the major pain inhibitory pathways are the opioid, the serotonergic or serotonin, and the noradrenergic, the more sympathetic fight or flight. And so if you think about it, we do need pain facilitatory pathways, right? That's protective. I always think about everything, the way that our bodies respond, as survival and as protective, even though they may eventually become more pathologic. But we have to have pain facilitatory pathways, right? If we're going to expose ourselves to something that's painful or hot, we have to know we have to know that. But then we also have pain inhibitory pathways to try to dampen the pain. And that's always a balance. And in patients with chronic pain conditions like IBS, there's more information that gets to the brain that we process it, and we can't balance it with having some descending pain inhibitory pathways. Because if you think about it, if you're experiencing an unpredictable chronic condition where you say, well, gee, I was eating healthy, I wasn't exposed to anything, and I still had a flare in my symptoms, and you never know, can I go to work that day? Can I go out tonight? So when it becomes unpredictable, the way that we respond as survival is we're always very attentive to anything. Oh, is that in my abdomen? Am I going to have one of these bad days? Is something I ate? But that makes you hyper attentive and a hyper aroused state. And that doesn't allow engagement of some of these pathways from the brain to the gut to try to dampen those signals. So you can see that in a way it's protective, but in a way it could hurt you, because all the symptoms become much more amplified and bothersome. And then we have the autonomic nervous system that controls motility, secretion, immune system, as well as sensitivity as well. And there's a lot of gut hormones and serotonin that help communication between the brain and the gut. And a lot of that can get, altered.
I don't think a lot of people realize how socially isolating this disease could be, especially people with the diarrhea predominant, because you just are afraid to go out.
Yeah, that's something that people don't talk about, and it's probably hard for people. But I did this focus group some years ago, and there is this huge stigma related to IBS and these other types of bowel conditions. It's just still, I think, considered an intimate part of the body. It's not something you share, even though everybody does go to the bathroom. I mean, these are normal functions, but it's hard to talk about. I think the other aspect that makes it very stigmatizing and isolating is that, again, if you don't have a blood test or a imaging study that say, oh, you have a tumor or ulcer, and then you can easily treat it, that people start thinking, am I imagining it? And so it's harder to talk to people. And then I think, at least my experience has been, especially when people come with family members, they say, well, I just said to get over it, just, just let's get out, let's just go out. Or, so it's hard for other people to understand unless they're undergoing it, experiencing it. So people then tend to not want to share it.
Well, that's really one of the reasons I wanted to do this summit, is to make, talking about poop a household thing, because I see how many people suffer with this disease. I myself had it for many years, and I realize all the shame and blame that goes with it, and how I want people to know that there is hope. And that's why I'm interviewing experts such as yourself on this subject. And speaking of poop, my favorite subject, I love the Bristol stool chart. Do you have a favorite number on that chart?
Oh, I don't have a favorite number. I mean, you're aiming between 1 and 7. You're aiming for 3, 4, and 5. Yeah. It's such a great tool because it's easy to see, and patients can, pick the stool form that they have. And it's important because it actually correlates with physiology. It correlates with how fast stool and food move through the gut. But I try to train my patients to say, look, we're looking for 3, 4, and 5. So if you have type 6 or 7, which is loose watery stools, even in constipated patients, I'll say you're taking too much of whatever you're taking. You need to move, decrease. And if you're type 1 or 2, which is hard lumpy stools, you're not taking enough. But now my patients, they have this shorthand with me. Oh yeah, I had a 4, or that was a 7. You know what I mean? You don't even say Bristol stool form scale anymore.
Yeah. Thank you so much. So one of the symptoms that a lot of people with IBS seem to get, and even maybe people without IBS, that I hear as a chief complaint, is bloating, gas and bloating. And even worse is when it's visibly distended. And this could be something that even a man could get, where he could literally look like he's 9 months pregnant. And when people are like of a more petite size, it's almost devastating, because then people think you're pregnant when you're not. And what is causing the bloating, the distension, and how do you deal with that symptom?
Yeah, I really do think that bloating and distension are very challenging symptoms and signs. So just to define them, so bloating really is defined as a symptom, a sensation of feeling fullness or gas in your abdomen. So it's really a symptom, is what someone feels. Gas is really more meant about passage of air from below. So when someone says they have gas, it usually means that they're passing from below. Distension, or what we call visible abdominal distension, is more of a sign. It's the enlargement of the abdomen, increasing abdominal girth. And that's different than bloating, which is really just the feeling, the sensation. So some people have bloating, but they don't get visibly distended. We did a study some years ago that showed that, I mean, they obviously go together, but women are more likely to get distension than men with bloating. Men could definitely get it, but women more likely report distension with the bloating. So they have different mechanisms. The way I think about bloating is, when I'm thinking about it in my mind of why a person has bloating, I think about what goes in, what goes out, and what's in the middle. What do they feel? So when I mean by what goes in, what's their diet? Are they on highly fermentable foods, gassy foods? So is it partly diet related that they get bloated? Then I think about what goes out, meaning, are they constipated? Are they passing gas and stool regularly? Because if they're not, they can get more bloating. And then if those two are not an issue anymore and they still feel bloated, it's really more from a hypersensitivity of the gut. So pain and bloating are the two symptoms that are really, or discomfort as well, are what we call abdominal sensory symptoms. They're where they are indicative of when the gut's more sensitive. You know, like the threshold is lower, they feel more. So that's bloating. Distension is interesting. So there's a group in Barcelona have done a lot of studies on how gas is mobilized through the gut. And they showed that visible abdominal distension, okay, now we're not talking about people with ascites or fluid in, you know, or really more from obesity or some other cause. This is where it's usually flat in the morning, then it comes out usually after a meal. What they showed is it has to do, and they did a lot of like CT scan, ultrasound, EMG, where the diaphragm, which is our large muscle that separates our chest and our abdomen, and when we take a deep breath in and bring air into the lungs, the diaphragm contracts and it descends into the abdomen. So they showed that they'd infuse gas into the rectum, and you have to infuse almost 2 liters of air to get a 1 centimeter increase in abdominal girth. That's normal. And part of the reason why your abdomen doesn't really distend due to that, if you're normal, you know, if you don't have distension, is because the diaphragm relaxes and comes up into the chest and the abdominal wall muscles contract. But in patients with visible abdominal distension, their diaphragm stays in a contracted state that's descending in the abdomen. So the abdominal wall muscles have to now relax to compensate, to lower that pressure. And that's the visible abdominal distension. So one of the treatments for that they showed in a study, and we try to teach the patients that we see, is to do diaphragmatic breathing. So instead of breathing all the air into your lungs and descending the diaphragm further, you try to inhale, but you actually relax your abdominal wall muscles. And when you exhale, you actually contract them in. And you're trying to change the way the diaphragm's moving. That also increases vagal tone, the parasympathetic system. So they showed it, they had a study that showed that if you do this 3 to 5 minutes before and after a meal, that can reduce visible abdominal distension, which is not that easy to do, actually. But that is one of the actually treatments for visible abdominal distension, other than trying to reduce bloating, you know, by diet or medications.
Right. I would love for someone on your team to actually teach that technique to the viewers, if that would be possible. I think that would be a wonderful tool for people to have in their tool belt.
Yeah, if people want, Suzanne Smith, who's our nurse practitioner, integrative health practitioner, it took a while to do this, but she filmed a video, actually. It's about 7 or 8 minutes. It's on our division website. So if people go to the UCLA Division of Digestive Diseases and they choose under programs, the GI Integrative Program, Suzanne Smith actually filmed a video, and she explains why Diaphragmatic breathing helps GI symptoms, and she also explains how to do that.
Thank you for that resource. We will definitely link to it. And I know her and I love her and I hope to be able to interview her on this summit. So thank you for that. For people that aren't yet learning this technique, is there, people want a pill for every ill. Let's face it, that's our society. So is it best to prevent the bloating and distension, or once you have it, is it like too late? There's nothing you can take to get rid of it.
Well, I don't want to give any kind of hopeless message. So I think everything is treatable, at least getting better, maybe not getting completely rid of it. I do think that distension's a little bit hard when it gets, advanced. So I do think that if you do have bloating and not such bad visible distension, you really want to act on it. I mean, for everything, especially a condition like that, being more proactive is always better. But, you want to also be reactive and treat when you have symptoms.
So how important is diet to somebody once they have IBS? And because I know people that are on what most people would think is a very healthy diet, and they still have it and they still get symptoms of bloating and distension and sometimes even diarrhea or constipation.
Yeah, about 70% or so of patients with IBS and a lot of these other functional GI disorders like functional dyspepsia, for example, they'll report meal-related symptoms, meaning that they'll have more symptoms after a meal. Some patients don't. I would say the majority of the patients do, and that's been shown in studies. But our GI dietitian said something very interesting to me once that I haven't forgotten, which is a patient may eat a healthy diet, but it may not be healthy for the condition they have.
That is really brilliant.
Right? So like having a lot of fiber is obviously very good for constipation, but in patients with diarrhea, that's probably not the right strategy usually. So you have to think about, what your symptoms are due to, what are the mechanisms by which I have this, and then just try to target your treatment. And everybody's different. There's multiple factors. This is the thing I think is the main message about IBS is that it's multifactorial. And you have to think about what are the factors in that particular individual that's driving their symptoms. And it's more of an orchestrated effect. You're not just thinking of the violin section or the percussion. It's kind of like working together. And if you remove one aspect of that, the body finds a way to compensate. So you have to really think of a more integrative, like holistic approach and think of the person. I mean, usually when I see a patient, I can make the diagnosis pretty fast. What I spend my time doing is thinking about all the other factors that are playing a role that are external factors, but that could be also internal factors and their preferences and their perceptions, because that's really what you really want to get at.
It just sounds like there's not a one size fits all. It's not like somebody has high blood pressure and you give them a prescription to lower their blood pressure. Even the diagnosis takes time. And I think a lot of people don't even get to the point of going to the doctor.
Yeah, that's very true. Like I had mentioned, many individuals, because they're not patients yet, they actually don't seek healthcare for their symptoms. And there's probably different reasons for that.
Right. So there are people, at least I've known people that not claim because it's true, they have chronic constipation, yet they don't have IBS. What is that about? And some of these people that I know, they're eating a plant-based diet, they're eating tons of fiber, and they still don't go.
Yeah. So the IBS with constipation, that subtype, and chronic constipation, or what people call chronic idiopathic constipation or functional constipation, is really a spectrum. So they all have constipation, but it's whether you have pain or not that differentiates you. So in patients with IBS with constipation, they have pain is just more of a predominant symptom. So some of those patients will say, well, I'm going now regularly, but I still have pain. Like I took a medication, I'm now having good bowel movements, but I'm still having pain and bloating. In the chronic constipation group, pain is not a predominant symptom. Sometimes they can get pain if they haven't gone for days, obviously. But pain so it's a spectrum. So you have more pain in the IBS with constipation, less pain in the chronic constipation. But if we're just going to talk about chronic constipation, you can divide it up into subtypes. So one type is where the colon or the large bowel is very slow. And we call that slow transit constipation. And the longer that stool stays in the colon, the more water that gets reabsorbed, and the stools can get very hard. The colon can get very compliant or flexible, and they sometimes even lose the urge, like they don't feel that urge. Then there's normal transit constipation, where if you measure transit time, it's actually normal, but they still feel constipated. And that group has not been studied all that well. We're going to start a big study on that, trying to understand why do people who have a normal transit time still feel constipated. And then there's another group called the defecatory disorder, which just means that the stool may get through the colon normally, or it could be slow, but it's really the process of evacuation that is altered. They can't evacuate properly. So, and that's due to different conditions. You probably heard of rectocele, where you have an outpouching of the rectum, where the stool, a lot of women have that, but it has to be really large. A rectal prolapse, where you basically have telescoping of the rectal tissue and goes actually out the anus. And then there's the more common, which we call pelvic floor dysfunction or dyssynergic defecation, where the pelvic floor muscles don't relax properly. The rectum can't straighten and open and, evacuate. So if somebody has that defecatory disorder, you can give them a lot of fiber, but or laxatives, and they're not going to be able to evacuate because the treatment's different. And in fact, they've shown in a study that patients that have the dyssynergic defecation, where they don't relax their pelvic floor muscles, they actually are more likely to have distension, visible distension when they have bloating. So you want to always think about, could that be a contributing cause to the distension and the constipation? So fiber is not going to work, laxatives are not going to work because the mechanism is different.
Could pelvic floor physical therapy help these people?
Yeah, so if somebody actually has that, and you can diagnose it by something called an anorectal manometry, and also something called a defecogram, and that's not really as important. But if you document that you have it, anorectal biofeedback is really the best treatment. And that can work in, I think, about 70% of individuals if they go to a good center. That's a little bit different than pelvic floor therapists, although there's a lot of overlap. So that can be helpful, definitely.
I think you're right, though, that people get so embarrassed to talk about anything down there that a lot of times they don't even seek help. And I just want people to know that it's not hopeless, and help is available with experts such as yourself that make their lives work with this. So the people with the chronic constipation, regardless of the cause, what is causing that? Like you had mentioned with IBS, sometimes it's, they've had food poisoning, they've had early childhood trauma. With chronic constipation, what is the underlying mechanism for that?
Yeah, well, constipation really runs in families. It's often someone in the family has had that, so there must be some genetic predisposition. In slow transit constipation, where the colon's slow, they have found that there's certain cells in the lining of the gut or within the bowel wall called interstitial cells of Cajal. They're the pacemaker cells. That's actually decreased in patients with slow transit constipation, so they're not having these regular contractions. There's also evidence that, and I probably a lot of people don't know this, but when we have normal contractions, from top to bottom, that's called peristalsis, where you're moving. There's also retrograde contractions from the rectum and lower colon that go backwards, and that happens a lot when we're sleeping. Obviously, you don't want to have to go in the bathroom. But in patients with chronic constipation, particularly slow transit, they don't have enough of these propagating contractions from top to bottom, and they have more of the retrograde contractions. So it's not allowing good passage. People again don't know about the slow transit constipation. So for normal transit constipation, but for slow transit, it just means that you don't have a good contractility and peristalsis to move the stool through the colon.
So how often should people be emptying their bowels, and how do we help the people with the chronic constipation? Because like you're saying, sometimes just giving them laxatives doesn't even help.
So they've done studies in the general population, and it's always a range, obviously, but it's the normal bowel movement frequency is 3 times a day to 3 times a week. So there has been some misconceptions about proper bowel movements. Some people believe, you have to go every day, same time, but actually there's a range. Just like anything else, any other trait is 3 times a day to 3 times a week. So some of the chronic constipation patients, they they won't go every day. I'm usually trying to target at least the minimum, which is 3 times, a week. But some patients don't feel comfortable unless they go every day. They get a lot of the bloating or discomfort, and it's better for them to go every day. So
I just can't imagine going three
yeah, the
times.
other I should say that chronic constipation is defined by 6 signs or symptoms. It's not just about bowel movement frequency. So the way we diagnose chronic constipation is based on having at least 2 of the 6 symptoms. And what they are is so one of the constipation symptoms is having less than 3 bowel movements a week, having hard stools, like dry hard stools, pellet-like stools, at least 25% of the time, straining at least 25% of the time. All of them has to be more than 25% of the time. Feeling that after you have a bowel movement, you still don't feel empty. We call that sensation of incomplete evacuation. You could see that would be on someone's mind all day long if they never feel like they empty. Feeling like there's a blockage down there, even though there may not be a blockage, that sensation that there's a blockage below. And then also using your hands or your fingers to help pull out stool, or putting pressure on the bottom to try to help facilitate evacuation. So those are 6 signs or symptoms. And if you have 2 of those, for a chronic period of time, you actually meet the criteria for chronic constipation.
And then would they see a doctor such as yourself for some kind of treatment?
Yeah, I think a lot of people will try over-the-counter remedies, probably more so than even diarrhea, because there's more available. So there's fiber supplementation. So one thing, when patients go on high fiber diets, and you're aiming at 20 to 30 grams of fiber, which is actually a lot. The problem that we have, and that's why working with the GI dietitian is probably helpful, is that a lot of the high fiber foods are also very gassy, and they're highly fermentable, and they cause bloating. So sometimes just using a fiber supplement like psyllium, which has been shown in many studies to be helpful for chronic constipation or IBS with constipation. So it kind of allows you to find the right level and maybe not be so gas producing if you eat a lot of fruits and vegetables. So that could be a good supplement, but that's usually good for more mild forms of chronic constipation. When you get to the moderate severe, you really have to use, so a lot of people use stool softeners, which there's not a lot of evidence to show that that's that helpful. But there's over-the-counter laxatives that can be useful. They don't help so much pain, but they can help you have a bowel movement. And there's a fair amount of prescription medications now, more than we've ever had before, that can help with chronic constipation or IBS with constipation. And that's why seeking, some healthcare would be helpful, so that you have access to those treatment options if diet and fiber and over-the-counters don't help you.
Would they have to be on these medications the rest of their lives?
Yeah, a lot of patients ask that question. I mean, it's a good question. In general, chronic constipation, especially if someone, like a lot of times they'll say, I've had this all my life. It's something they've really have had. It's hard to understand or think that it's going to go away. I definitely can get better. When people travel, they tend to get a little more constipated. Even people who don't really have chronic constipation can get constipated. And as we age, constipation increases because the colon motility starts to slow. So, but IBS, not necessarily. As we age, IBS is actually less prevalent. But for chronic constipation, it becomes more prevalent.
Wow, that's so interesting. The few people that I'm thinking of in my personal life that have chronic constipation, they do zero exercise. Can exercise play a role in motility? And I mean, we know it's helpful just in general, but I'm wondering how it can affect some of these functional GI disorders.
Well, people who ambulate, they've had studies that show that people who ambulate more are less likely to have constipation. So the more ambulation and exercise that you have, the less at risk you are for constipation. It doesn't mean that if you have longstanding constipation and you exercise, that's going to be only treatment, but it definitely helps. Drinking a lot of water, there's some debate about that, but in general, I think it's useful to do that, of course. The bowel has just a really great capacity to reabsorb fluids. And that's why even if you drink a lot, it doesn't always help. But extra physical exercise will definitely help the constipation. There's also data to show that it helps IBS symptoms. It's harder for patients who don't feel well or they feel fatigue to do that, but definitely exercise. You just don't want to go overboard with it, But yeah, exercise obviously is right. And also the other thing I think that helps people and helps me, and I'm sure other people, it kind of reduces stress, too. It's kind of an outlet for people.
Yeah, that's great. That's a great idea. What about some of these home remedies you hear about for people with GI distress, like fennel and peppermint? Are these things that people can be doing on their own, or are there risks to those?
We don't always have we don't have really good scientific data for a lot of these home remedies. There is actually good data for peppermint. So peppermint capsules have been studied for a long time, and peppermint actually has been shown to help IBS symptoms because they actually act as relaxing the muscle in the bowel. So it's like an antispasmodic. So it helps people, particularly after meals. They could have more loose stools or discomfort or pain or bloating, and peppermint's been helpful. The issue with peppermint, though, is that it can cause more heartburn. So they've actually made certain preparations to encapsulate it. Like there's one that's very popular that's over the counter called IB-Guard, and you swallow it, it gets absorbed in the small intestine, and you could take it, up to 3 times a day, 2 capsules 3 times a day, and it can help reduce, abdominal symptoms. And there's a lot of other peppermint preparations that may do the same thing. Some people use like chia seed or flaxseed for constipation. I don't think there's that much evidence for it scientifically, but I know that that can help patients as well.
Right. You mentioned heartburn. Is GERD another one of those diseases that you see a lot in your practice?
Well, GERD is one of the most common conditions that we see in the general population. People don't come to see me specifically for GERD per se, but GERD overlaps a lot with IBS and chronic constipation and diarrhea. So that it's easier to treat for a vast majority of patients, not all. So patients can take a lot of over-the-counter remedies now. There's what we call histamine 2 blockers, antacids, the proton pump inhibitors, and they, for a majority of subjects, individuals, help them a lot. There are patients that don't respond to those medications who have GERD, but more likely they have something called functional heartburn. So that means that they have heartburn. It feels like they have GERD, but they don't really have a lot of acid, more acid than normal, coming up from their stomach to the esophagus. That's how you diagnose that someone has GERD, is that they have to have a certain amount of acid that comes up over a 24-hour period of time and gives them heartburn. And some of those patients, they don't have that, but they still have heartburn. And it's likely due to that the gut is just, the esophagus is more sensitive.
Wow, that's incredible. So then medication wouldn't help them since they're not having the increased acid.
Well, not medications that suppress acid, or it'll give them some partial response. Some people do have acid-related symptoms, so they treat that part with the proton pump inhibitor, but they'll still have persistent symptoms, which means that the esophagus is more sensitive to acid. So sometimes you can use more of these, what we call neuromodulators, or medications that reduce the sensitivity. It works on the nerves to reduce the sensitivity of the gut, of the gastrointestinal tract.
That's great. Can you talk about some of the behavioral therapies that you offer patients with IBS, what they are, and specifically how they can help?
Mm-hmm. So there's a range of them. One that's been studied the most it's called cognitive behavioral therapy, or CBT. And what that type of behavioral treatment is, it's trying to increase the sense of control over symptoms, and it's trying to get away at catastrophizing behavior. And catastrophizing means that you're anticipating that something's going to happen in the future that's negative and that you're not going to have control over it. So, you could think about if someone's having diarrhea, they may be thinking, oh, gee, now I can't go out. I won't be able to work. I might lose my job. That's more of, which is completely understandable. But cognitive behavioral therapy tries to understand the thought process that gets this chain of events that increases their symptoms, and tries to separate what's controllable and what's not controllable, and to work on the cognitive thought process. There's hypnotherapy, or what we call gut-directed hypnotherapy, a deep relaxation state, and tries to improve the imagery. A lot of people might have this imagery of what's going on in their gut, that it's, going to explode, or it's really tight, and it's trying to help with that aspect, and it could be very useful. There's now more data or increasing data that mindfulness, meditation, or what they call mindfulness-based stress reduction is helpful for patients as well. There's also a different type of, it's kind of a different version of cognitive behavioral therapy called acceptance and commitment therapy that people are starting to use in GI conditions. So there's different types of treatment. And I think that what you're aiming for is giving the patient some tools to help them manage their symptoms long term. And it's helpful to do that because, I think everybody wants to get off medication. And, you could think it could help other aspects of their life, right? So cognitive behavioral therapy is used very much for anxiety, for example. Same with hypnotherapy.
These are, I think the thing is that in general, insurance companies they don't reimburse for these modalities, which are so useful. And,
so GI health psychology is becoming very large, just like GI dietitians. So we have psychologists that totally focus on GI health. And what's interesting about the billing for them is the diagnosis is actually based on the GI condition, not on a psychological diagnosis.
This is going to help then, because then more people maybe can seek treatment. How did you get so interested in treating functional GI disease?
Yeah, that's, I actually started my career working in a county hospital and seeing a lot of GI bleeding cases and doing more pancreatic biliary work. But it just didn't, it wasn't as intellectually stimulating, to be honest, to me. And it was actually what happened was I was one of my mentors, early mentors, studied this. So I studied it more from a motility perspective. But what happened after I finished all my training is Amron Meyer, who you're going to be interviewing, he had been at the place I was at in the past, and he went to UCLA, and he was looking for someone to collaborate on IBS. And so I started working with him, and I really liked this whole area of brain-gut disorders. And I like thinking about physiology and psychology and the biopsychosocial approach. So I started working with him, and then he became my research mentor. And then I moved to UCLA, and it just resonated with me. I'm just like a person that likes to know something comprehensively. I may not have a lot of breadth, but I have more depth. And I like the integration of a comprehensive, multifactorial, integrative approach. I like that. It's very interesting to me. And, I learned how to take care of patients with Doug Drossman. I think that was really helpful to me to understand the patient perspective and how to communicate with patients. So I know it just resonated with me. I just find it very interesting. I find human behavior one of the most fascinating things about life.
Wow. And you, I'm guessing you didn't personally suffer with any GI issues yourself.
No.
And it's just
amazing.
amazing.
I will tell you though, when I had food poisoning, I thought, oh, this is what my patients feel like all the time.
That's good. You could be empathetic, but it's amazing how much both passion and compassion you have for this. And I really do appreciate that so much. It's just, I think what's difficult is because it's not like we said, high blood pressure, they just give you a pill. It's such a multifactorial disease, and the approach, it's just a little bit more complicated.
It is. And the thing with, even in blood pressure, you probably have to, there are probably certain medications that work for certain individuals, and diet is important. But I think the hypertension, you have the blood pressure as an objective measure. In IBS, chronic constipation, you don't have a good objective measure as much. So it's harder to, I think, accept that an individual has that. It's probably hard I think it's hard for patients. We're looking for a positive test, and we're looking for a metric by which we can normalize. And that's more of a, something that we're working on, but we just don't really have it yet.
Well, I'm hoping.
But it doesn't mean the symptoms aren't real. See, that's an important message.
And that's the message I want, and the hope for this summit, that people will see this and realize there's no shame, that a lot of people have this, but they need to seek some professional help for it. So, Dr. Chang, what is the truth about GI health?
I think that it's important for people to know what the gut's function is. The gut's function is to digest foods, absorb for nutritional status, but it's also to store stool. So you don't want it completely empty. It's not supposed to actually be completely empty. A lot of people want that, and they think there's toxins. I would say the gut is pretty resilient. It has its own nervous system. It has a good immune system because we put all sorts of things, that we're eating, and it has a lot of systems in place to keep it healthy. So it's important to understand what is normal, just like we talked about what's normal bowel movement frequency and what's the gut's normal function. But I just think eating regular meals, having a more diverse diet is helpful because that increases bacterial diversity, and the bacteria is good. It's not bad. I mean, there are sort of bad pathogens, but in general, most of the bacteria are helpful to us. They have a lot of functions that I'm sure you've talked to or you will talk to with a lot of your guests. So I think it's important to remember that, and that some of the way the bowel responds, it may be more of a measure of what's going on in your whole body, and it can get dysregulated, but it can actually go back to normal again. And that we have a lot of treatments in place and diet and medication, everything to try to help us to normalize as much as possible. But the gut is a very sensitive place, and it's a very instinctive, sensitive place, right? Why do we say gut? My gut instinct is, my gut feeling is, because a lot of what we feel in our bodies is we feel it in our gut. So it's doing its job. Sometimes it's just overly sensitive.
Yeah, that's a great way to say it. And I know that you and your colleagues at UCLA are doing so much to make this happen for patients to get better. So there is hope.
Yes, definitely.
Thank you so much, Dr. Chang. I really enjoyed talking to you.
Yeah, thank you so much.
Wow, wasn't she great? I got to tell you guys, she was one of my doctors when I was in Los Angeles. And it's interesting because I was referred to her by yesterday's kickoff speaker, Dr. Mark Pimentel, who had been my doctor at Cedars-Sinai many years. And what had happened is I was doing well. I had a long history of GI problems, IBS, SIBO, you name it. If you watch the introductory video, you know pretty much all of them from mouth to anus. But specifically, I was seeing Dr. Pimentel because I had unretractable SIBO, I had food poisoning, I had an ulcer from Japan. It was all from international travel, basically, in my case. And after being on 3 rounds of rifaximin, the SIBO was finally knocked out after 8.5 months of being on the most restricted diet in the world. And what happened is I had seen him in my biannual checkup. This would have been in 2018, and he was asking me how I was, and I was basically fine. And I had told him a little story that had happened in 2017 when I had went to my 40th high school reunion. And I know not to eat at these events. It was a $100 dinner, by the way, and there was nothing I could have eaten anyway, and being, whole food, plant-based, and I always bring my food with me, but I had eaten earlier in the day, just to be sure, and I had a food cooler with me, and I got to the reunion and it was so stressful. It was the worst experience of my life emotionally. And I remember just experiencing immediate diarrhea because my IBS was diarrhea, even though they said that women mostly get the constipation form. And immediately I had urgency and I had diarrhea, almost had an accident actually at the reunion getting to the bathroom. And then of course that led to immediate distension, which was very painful. And I remember texting my psychologist, Dr. Doug Lyle, and asking him what to do. And he said, well, just leave. It's too stressful. So I called my husband to pick me up because I had gone with a friend. And I remember telling this story to Dr. Pimentel, and he said, well, then you need to see Dr. Lynn Chang because she is like the world's leading expert on the emotional component of IBS. So I waited a year to see her, and it was completely worth it. She's a most wonderful, wonderful doctor. And, we realized that until I could manage my stress, I was never going to really manage my IBS. And so with that involved with me was actually leaving Los Angeles. And for the last 2 years, my gut has been perfect. As a matter of fact, I'm proud to say I'm 4 on the Bristol Stool Scale. And if you want to know what that is, just Google it. And all the speakers in the summit just got a thank you gift of a coffee mug with the Bristol Stool Scale on it. So there's so many great takeaways from Dr. Chang. I'll just list a few of them. You know, I love how she said that instead of calling them functional GI disorders, which some people still think mean in your head, they're now calling them disorders of gut-brain interaction. And that I couldn't believe that that's the most common diagnosis in a primary care practice. And she said it was the second most common diagnosis in GI practices right after GERD, gastroesophageal reflux disease. And it's difficult because with people with these functional disorders, they're not normal, but there's nothing they can see structurally or on imaging, but the symptoms are real. So I want to encourage you, if you have symptoms, they're real, and to please, seek help for them. And, mentioned like yesterday's doctor that for some reason that women seem to have more of the constipation variety, men the more diarrhea variety, but that it's not just diarrhea or constipation with IBS, that it's linked to the recurrent abdominal pain. So there's no diagnostic markers to test this. They use this. They have to use symptom criterion, and it's amazing that it has a 15% prevalence worldwide. Now, she mentioned something called the Rome Foundation, and you're going to learn more about that from an upcoming speaker, Dr. Doug Drossman, who is actually the founder of this foundation, and he's actually going to be doing a live one day during the summit. I believe that's Thursday. It's sad that the majority of people with IBS symptoms don't seek healthcare. And most of them are women, because women in general are more likely to seek healthcare. So we encourage you to please, seek help for this. There is a lot of hope, and there are people out there that can really help you. She talked about multiple risk factors, and including infection. I know in my case, it was started with an infectious disorder, but there's also a genetic predisposition. And she got into a little bit about the stressful life events, particularly in childhood, can increase the risk. And Dr. Drossman is going to cover that even in more detail when he comes on the summit. But the main thing is if the stress is prolonged, because she explained how chronic stress changes gut motility, it changes gut sensitivity, and it changes gut permeability. So guys, we've got to find ways to better manage our stress. She said the stress even changes the way the brain processes the information. So that'll affect how much pain you experience. So it's incredible, this communication between the gut and the brain. And unfortunately, we live in a society that's looking for a pill for every ill. And there is no pill for building up resiliency. That's a word you're going to hear from a lot of our speakers, resiliency, this notion of resiliency. It's going to keep coming up. There's no pill to build it, but there are medications that can be given to you that can help normalize your gut so that you can learn to build your own resiliency. And a lot of the speakers in this summit are going to touch on that. I found it fascinating when she talked about the pain inhibitory pathways and the pain facilitatory pathways. I'm going to have to listen again to really try to understand that, but apparently they're different. And so that was very interesting to me. And the GI problems can be very socially isolating, especially people with the diarrhea type of IBS, because that's the kind I had, and you just worry, I can't go out, I can't be on a plane, what if I can't find a bathroom? But we have to normalize this, and I can assure you that all the speakers on the summit have heard this before. So please don't let shame or embarrassment seek you from getting help. We got to make pooping great again, guys. So it's important that you guys understand the distinction between bloating and distension. The words are often used interchangeably and incorrectly, and they're not. People say I bloat, but bloating is a feeling. Bloating doesn't result in the visual distension of your abdomen. Bloating is uncomfortable, but it's not something you see visually. Distension is when your tummy poofs out. And I hope that we can get you the picture so you can see what I used to look like. I'm find a way that we can maybe post it on the summit page. But I love when she talked about the study in Barcelona, and Suzanne Smith is going to touch on this as well, that when you have the problem with the people that have visual abdominal distension is that their diaphragm is staying in a contracted state. So the research shows that if you do this diaphragmatic breathing that Suzanne Smith will teach you on the video, she's not teaching it during her summit session, but we're going to link to her video, that has been proven to help if you do it regularly, especially before and after a meal. And I loved how she said that you may eat a healthy diet, but it may not be the healthy diet for the GI condition you have. That's why we have 4 registered dietitians who are specifically dietitians for GI disorders. They work with and for gastroenterologists, and actually 3 of them can do telemedicine pretty much anywhere in the world. So you might want to consider working with one of them if you have not found the diet that is right for your GI condition. But it can include plants. We can promise you that. Fascinating about the chronic constipation, how some of it has normal transit time and some of it has slow transit time. But there are people with these defecatory disorders, and this is why we brought on so many of the allied health experts, because when you have an evacuation disorder like rectocele or prolapse or pelvic floor dysfunction or dyssynergia, fiber's not going to help. Laxatives aren't going to help. So that is why we have 2 of the best pelvic floor physical therapists coming on, Julie and Mandy, that are going to talk about this, and other doctors that are going to talk about this. But she explained that for that, you will need some of these other treatments. Biofeedback was another one. But please remember that if you have slow motility and you're not exercising, you got to start exercising, because it's good for the gut. And you're going to hear something really interesting about exercise and the effect on the microbiome from one of the speakers today. She had mentioned peppermint oil, and I think Nancy Jaffe is going to talk about that as something during her session. And she talked about MSBR, CBT, gut-directed hypnotherapy, acceptance therapy. Well, we've got at least 3 or 4 more experts that are going to dive into deep detail about those and how those can help you. They're all wonderful. And even though we didn't cover diet too much in this talk, she did say, like the other speakers, that you need a more diverse diet, diversity of plants for the healthiest microbiome. So I hope you enjoyed Dr. Lynn Chang. And next up, we have Dr. Uma Naidu. She is a Harvard psychiatrist and a trained chef. She has a very short broadcast because she came to us after the summit was basically completed, but she really wanted to be a part of it because this is one of her passions. And she's going to be talking about, is the gut really our second brain, and what are the implications? Please welcome Dr. Naidu to the summit.
Hi, everyone, and welcome. My name is Dr. Uma Naidu, and I am delighted to be able to participate in the GI Summit. I am based at Harvard Medical School in Boston, where I'm the Director of Nutritional and Lifestyle Psychiatry at Massachusetts General Hospital, one of the teaching hospitals at Harvard Medical School. The first point I'd like to share with you is that the brain is body royalty. In the average adult human, the brain represents about 2% of the body weight. Yet, despite its relatively small size, the brain accounts for about 20% of the oxygen and hence calories consumed by the body. That is, it consumes about 20% of glucose-derived energy. Now, you might ask why this is important. Well, I think that one of the missing gaps in our discussions with doctors and clinicians is that we go in and speak about having gained a few pounds. Perhaps we have a family history of diabetes or concerned about a cholesterol level. But no one is making the connection between how we eat and how we feel emotionally. And this is where the gut-brain axis and microbiome, as well as the function of the brain, becomes extremely important. The implications actually become that energy-efficient food can boost our brain's energy, our body health, as well as our overall well-being. And I would add, our mental well-being. Another aspect of an implication is that in the current times in which we're living, stress, burnout, anxiety, and depression can all be addressed by addressing how we eat. It is not a one-size-fits-all, and it is not the only solution, but it is one of the tools in our toolkit. I am an allopathic trained physician. I prescribe medications, and medications have certainly saved the lives of many of my mentally ill patients. But I would also share with you that food, nutrition, and how we eat is an incredibly powerful tool that we can all use alongside any other means of treatment that your physician prescribes. I'd like to share what nutritional psychiatry is. While it is a nascent term, many of us have been practicing using the impact of nutrition and mental health for some time. I have created this as a way to share that nutritional psychiatry offers clinical guidelines based on nutrition science and evidence-based research for the use of whole foods and nutrients to improve mental well-being. A few years ago, I was featured in a weekend article published in the Wall Street Journal. And what I found fascinating was I did a very long interview with the wonderful reporter who wrote this article. And one of the things she picked up on was a comment that I made, which is that nutritional psychiatry is not about 10 milligrams of Prozac or 10 blueberries. And I always quote that because it actually does share with someone what we are not talking about. It's not either or, it's not medications or food. It's really the combination of what works for the individual. And because of the mostly unique microbiome that we each have, I would even go so far as to say that personalizing a nutritional psychiatry treatment plan has become a very, very vital part of my practice these days. Now, a long time ago, Hippocrates shared that all diseases begin in the gut and death sits in the bowel. I think this was a very meaningful statement, and I share it very often because he was clearly on to that connection between the gut and the brain. In early development, the enteric nervous system was discovered in the middle of the 19th century. It is entirely derived from neural crest cells, which migrate to the gut and maintain connections to the brain. The rationale of the gut-brain connection in mental health are based on things like embryology, that the gut and the brain actually originate from those neural crest cells in the embryo. Anatomically, throughout life, these organs remain connected by the 10th cranial nerve called the vagus nerve, which I like to call a two-way superhighway because of the bidirectional flow of messages back and forth between the brain and the gut and the brain. Neurochemically, there are chemical signals which are transmitted, and pathologically, there are actually diseases which indicate to us also that there's this connection. Looking at physiological perspectives, one of the things we should remember is that there are at least 100 million neurons in the gut, and that the gut peptides influence hypothalamic pathways. I would also say that this particular study, quoted, shares that the gut-brain axis and this interface through the use and connection of the vagus nerve senses the microbiota metabolites through its afferents and transfers this gut information to the central nervous system. The integration in the central autonomic network can generate a response, and it can be cholinergic and anti-inflammatory pathways which are modulated in the microbiota. And stress inhibits the vagus nerve in situations such as inflammatory bowel disease and IBD. This is just a diagram to indicate the anatomical connection and to share that the vagus nerve runs from the brain directly and encompasses the gut. This particular study really looked more closely at the neurochemical and electrical connections between the gut and the brain. Why is it therefore that we often call the gut the second brain? Now, there are approximately 39 trillion odd microbes in the microbiome, and there are different types of microbes. While we know this, we wonder why it is that the gut is considered to be the second brain. Now, some of what I've shared already will indicate to you that there's a reason that these two parts of the body are both connected. And when gut bacteria change, the signals to and from the brain change as well. And so it is often called the second brain. Some functions of healthy gut bacteria include breakdown of complex carbohydrates, production of vitamins and nutrients, production of short-chain fatty acids, extremely vital to our physical and mental health, protection against pathogens, helping to train the immune system, supporting detoxification, and modulating the nervous system. Another point that I think is very important to know is that a very large part of our immune system is also located in the gut. Moving on now, we also see that anatomically, these are the connections, and we understand that there's this very immediate interface between the gut lining, the afferents, the nervous system, and then ultimately a connection through the vagus nerve as one of the ways that the gut and the brain remain connected. Now, another important thing for people to understand is that serotonin is often called the happiness hormone. And some of the medications that psychiatrists and other doctors prescribe include selective serotonin reuptake inhibitors. Examples of these include medications such as Prozac or Zoloft, otherwise called fluoxetine or sertraline. There's several others as well. They act through serotonin, but 90% or more of the serotonin receptors are found in the gut. Another way which helps you understand that close connection between where food is being digested and its connection to impacting serotonin receptors. Now, one of the important things to understand in the gut-brain health is that dysbiosis or inflammation of the gut has been linked to causing several mental illnesses, including anxiety and depression. And one of the ways that dysbiosis gets set up is by how we eat. Now, there are multiple factors which cause and affect dysbiosis, but food is one of those things. So if we're eating a fast food, junk food diet full of processed and ultra-processed foods, which contain colorants, dyes, food stabilizers, and preservatives, they definitely impact the gut in a certain way. Also, refined sugars, trans fats are some of the problematic foods. What happens is that inflammation gets set up in the gut, and the influence of the good microbes get overcome by the bad microbes in the gut. And when the bad microbes overthrow the good microbes, what happens is that we get set up for inflammation in the gut. Studies have also shown that probiotics were effective in lowering anxiety and depression symptoms, similar to traditional prescription medications. Why do I say that? Because again, it speaks to sources of probiotics through foods, such as fermented foods, which actually could impact this exact factor. So how we eat is directly correlated to the setup of dysbiosis or inflammation in the gut lining. And this is a slide which just further emphasizes what I said about serotonin being a very large component in terms of the receptors being found in the gut. This particular study spoke to the role of inflammation in the gut microbiome in depression and anxiety, and is worth reading and perhaps reviewing in terms of understanding why this connection in nutritional psychiatry is so important. I would also share with you that of the many things we should be concerned about right now, while cancer and heart disease continue to be some of the leading diagnoses in the world, I feel that metabolic diseases are so much on the rise. And a combination of the triad of insulin resistance, oxidative stress, and inflammation are contributing to this factor in mental health that becomes extremely important because of a few facts that I will share shortly, but also the fact that some of the medications that are prescribed, if a person is taking medications, may actually impact insulin resistance and metabolic health. And it's really becomes finding a solution for creating a balance of useful treatments for the individual. And in mental illness, one of the things I would share is that individuals living with a serious mental illness face an increased risk of having chronic medical conditions. And adults living with a serious illness die on an average 25 years earlier than other Americans, largely due to treatable medical conditions. So, making the point that we really need to understand what is going on with our metabolic health. And one of the things that impacts that is not only our GI health, our gut microbiome and the gut-brain axis, medications that we might be taking, stress, and so many other factors. I would just also share that the context of gut-brain health and mental well-being becomes extremely important during COVID. And that during COVID in the United States, one of the very scary statistics that was shared by the CDC just a few months ago was that during the ongoing pandemic, approximately 11% of Americans considered suicide, speaking to how desperately depressed, sad, uncertain, fearful, and anxious that people are feeling amongst other symptoms. And I would share that, The evidence base for these conditions are really about finding a multifactorial approach, which includes different types of diets, includes the research behind it, understanding the impact of the very powerful gut microbiome, and finding personalized nutritional psychiatry solutions which improve GI health and improve therefore mental well-being. I think it's less about the calorie counting, the actual diet that you're following, but actually the eating of whole healthy foods so that you embrace a solution that relates to your mental well-being. And why do I say that? As a psychiatrist during these times, our mental health has become so critically important. I have explained to you that there's this physiological, anatomical, biochemical, and neurochemical connection between the gut and the brain and the brain and the gut. What we eat through the process of digestion, therefore, impacts our physical health through the gut microbiome, but then our mental health as well. Thank you so much for your time and attention, and it has been a pleasure speaking with you today.
Well, that may have been our shortest interview, but that doesn't mean it wasn't profound. We look forward to hearing more from Dr. Naidu in the future. And she's not the only psychiatrist that's on this summit. You're going to look forward to meeting Dr. Doug Drossman, the founder of the Rome Foundation, who is both a psychiatrist and a GI doctor. I love how she said that no one makes the connection between what we eat and how we feel emotionally. Food is a powerful tool that can be used along with any of the other treatments that your clinician prescribes. And as we know, the Americans are not doing a very good job with the food because 97% of them aren't even getting anywhere near as much fiber as they need. And she concurred what many of the speakers have been saying. Hippocrates knew it so many years ago that all disease begins in the gut and ends in the bowel. And you really can't have optimal health or optimal gut health unless you have optimal health. And so that's what this is about, is being healthy everywhere, not just your gut. She talked about the vagus nerve, and many of the other speakers are going to touch upon that, how it's a two-way superhighway. And that's how the gut and the brain are talking to each other. And that's why we call the gut the second brain. Incredible that there's 100 million neurons in the gut, 30 million microbes. There's a lot going on there, guys. No wonder so many of us have problems down there. And she mentioned the short chain fatty acids. Almost every speaker talks about these. These are essential. And if we don't eat fiber, we're not going to get them. And guess where fiber is? It's only in whole plants. It's not in processed food, and it's not in animal products. And she, again, talked about how that our immune system, 70% of it's in the gut. So if we want to be healthy, we've got to have a healthy gut. Optimizing gut health is very, very important. And as a psychiatrist, she knows a lot about serotonin. She prescribes medications that are serotonin reuptake inhibitors. It's known as the happiness hormone, but 90% or more of the serotonin receptors are found in the gut. So what you eat matters. It affects your mood, it affects your gut, it affects your health. So we need to really focus on the right diet for our condition, but it's got to be plants, at least primarily plants, and we've got to have that fiber. So the next speaker is Dr. Kirsten Tillich, and she is going to be talking about how some of these other modalities that you wouldn't think would be important in people with GI disorders can be very effective, especially if your condition has been unretractable and non-responsive to medications and things like that. She's going to talk about how yoga, meditation, acupuncture, and other gentle practices like Tai Chi can really help your overall health and your GI health especially. And I'll tell you a little story about her at the end because I was a patient of hers a long time ago. She's a wonderful, wonderful doctor. Her name is Kirsten Tillich, and please welcome her to the summit.
Hi, Dr. Tillich, and welcome to the GI Health Summit. Thank you so much for being here. I'm really excited for the opportunity to talk to you.
Well, thanks for having me. I'm happy to be here.
It is my pleasure. So Dr. Tillich, what is GI health? How do we know if we have it? How do we achieve it? And once we achieve it, how do we maintain it?
Yeah, well, it's actually a pretty big question. So GI health is not one of those things where we can do a test and say, aha, you did this blood test, or you did a stool test, or you did an x-ray, and that's GI health. Really, the way we look at GI health is, how do you feel about how your gut's doing? And that really is whether you're feeling symptoms of discomfort, whether things are moving easily down the GI tract, whether you're distracted from it in your day. Do you feel heartburn? Do you feel bloating? Any of these symptoms that are bothersome through the day and are really common among people throughout the age span, throughout the world, really, but very common in the US. And it's really not noticing the GI tract often is GI health. So that's one piece of it, how you feel about your gut. And most of us, anything that goes on in the GI tract, for the most part, it comes up to the brain, and the brainstem is able to say, oh, everything's fine. We don't need to hear about that. Leave that alone. And really, we only get information when we need to. And that's usually from a simple thing like you have to run to the bathroom, or you need to eat something, or something really serious is going on and you need to talk to your doctor. So most of our GI health is going to be lack of information from the GI tract. That means it's working well. The other piece of it is, however, the more complicated piece of GI health is the fact that the GI tract is our biggest interface really with the world and how we get our nutrients. And it communicates with all of our organ systems. And if our gut is not processing things well, we're going to have an increased risk of all kinds of other diseases. So it can impact heart disease, it can impact diabetes, it can impact our risk for cancer. So it's not just GI symptoms that are important in GI health. Having GI health really helps our overall health as well. So it's really a big thing, and it's key to our overall well-being.
How did you get interested in integrative medicine for helping people with their GI issues?
Yeah, it really came not so much from me, but from my patients. I was trained very traditionally. I didn't have any integrative medicine training. But when I went to see the patients, the ones I was most interested in were people who had chronic gastrointestinal disorders that we couldn't really figure out, and we didn't have the right medicines for. And so they often would get really frustrated with their doctors, and doctors would get frustrated with them because they weren't able to come to the sort of solution that would make everybody happy, mostly the patients. And so they would say, oh, well, I was going to try this, I was going to try that, a supplement, an herbal medicine. There was a study way back in, I guess, the 90s about traditional Chinese medicine and irritable bowel syndrome, herbal medicine and acupuncture that got me really excited. There were some studies in other pain disorders about mindfulness-based stress reduction and mindfulness meditation. And when I learned about those, I thought, wow, this sounds just like what's going on with my patients. And so I just reached out and I started learning about things like mindfulness and yoga and hypnosis and acupuncture and herbal treatments. Probiotics came more popular. And I started learning about all of these things that I could use to help support my patients rather than say, I don't know, I'm a doctor, I don't do that. I realized like, oh my gosh, I need to know all of these things so that I can help people. So I got trained in a lot of different areas and found that, yeah, this was a way that I could really help people. And at UCLA, build a multidisciplinary team of nurses, mindfulness instructors, psychologists, dietitians, where we could kind of broaden it even more and bring together sort of the package that we need to treat patients. And then it perfectly aligns with the work that I've done as a researcher. So in parallel, I've been studying the brain and how the brain and the gut are connected. And when we get to studying that connection, it's something that's really clear anatomically. You can find it in an anatomy book. Here's the brain. Here are all those nerves that go to the nervous system of the gut, which is really complicated. So they call it the second brain. We know that's there, but we really didn't know how they interacted in a practical way. And so working with a team at UCLA, I've done a series of studies looking at the brain with functional MRI imaging, structural MRI imaging, and trying to really understand when we perturb the system or we make changes, how can we show that things are affecting the gut? And it completely meshes with integrative medicine, because most integrative medicine is doing something similar. So acupuncture is changing the autonomic nervous system, which is what we're studying, that connection between the brain and the gut. Mindfulness, hypnosis, other behavioral therapies are changing and remodeling the brain in those areas that perceive pain and discomfort and distress from the GI tract, and send down signals to the GI tract to make it act differently. So my research was going one way, and my clinical practice was going another way, and they beautifully came together in a way that has been really fun for me, and I hope helpful for the people that I take care of at UCLA.
The modalities you talk about sound wonderful. The people I know want to feel better now. They're looking for a pill.
Yeah. Story of our life, right? We want that magic drug that's gonna fix things. And often when I'm talking to a patient, for example, with irritable bowel syndrome, I may be talking to somebody who's had symptoms for a decade or more, or maybe just a year, but they've had symptoms for a long time. And they'd like, well, I want that thing that's just gonna make it better. And we look and we say, well, what do you think is causing the symptoms? How do these symptoms come about? And they come about really from our genetics, our upbringing, what happened, what diseases we may have had, what stressors we may have had, and how our nervous system developed in conjunction with the nervous system of the gut. And then something may trigger the symptoms to get worse, activates a whole bunch of different pathways that lead to the distress of the onset of these symptoms. And then we have to say, oh, I'm going to give you a pill that makes that better. It doesn't work that way. We need to remodel the brain to get things back on track. And people think that's going to be impossible. It turns out it's not. The brain is moving all the time, every age. People used to think, oh, the brain stops remodeling when you're, a teenager. No, it's remodeling all the time. And so when someone's had chronic symptoms, they're the symptoms that are really being generated from the GI tract, and there's the symptoms that are actually being generated from the brain. And the brain's tendency to, instead of really pay attention to what's really going on, to pay attention to, I always think of it like a jukebox. Oh, I feel something in my gut. The brain's like, oh, I'll pull out that record, and puts on the record that says, you feel terrible today. Well, maybe the gut was going to be just fine if it hadn't taken that record out and put it on. But the brain is just being efficient. It knows how to drive me to work without me thinking. And it knows how to decide, oh, you don't feel good because you just ate something you shouldn't have eaten. So there's not a silver bullet for this. I started out my research trying to look at these very specific targeted drugs for irritable bowel syndrome, and none of them worked. So developmental drugs, the field kind of fell apart, because the drugs that we thought would be the silver bullet, they don't work because they don't address the key problem, which is the brain, the gut, and everything we put into our mouths, our environment. It's really, we talk about holistic medicine. This is holistic medicine. It's not one part of your body when we talk about the gut. It's everything. So we want to work on, when I try to work with patients, it's not just working on, I do prescribe medicines to say, I always say this is a crutch until we get you where we want you to be, right? So we give medicines to reduce symptoms, but those aren't the cure. Those are medicines to reduce symptoms while we allow the brain and the gut's nervous system to remodel and get back to health. And we do all that we can to support healthy habits, healthy eating, healthy lifestyle, healthy thinking, to get that jukebox to play what we wanted it to play, what it played when we were feeling better. And it's interesting, and that's often what people will do in hypnotherapy. Well, let's get you back to that state. Like, when's the last time you felt good? sometimes you can get people to feel good. And they're like, wow, how did I feel good for that hour even? Well, if you can feel good for that hour, we can get you back to feeling good. We just got to break through all the things that are standing in the way.
That's fascinating that you can remodel the brain. You know, Dr. Tillich, most people, when they go to the doctor doesn't ask them what they're eating or what kind of stress they have, even GI doctors. But I know that for you, that's an important question you ask your patients.
Yes, and there are a lot of reasons why these questions aren't commonly asked. One is because we didn't, most of us didn't learn about this, so we don't know. Our training in nutrition is, for the most part, dismal. I think it's younger doctors are getting better education in nutrition, which is fantastic. Sometimes there isn't even enough time, or we're not comfortable. We haven't had enough training to talk about people's stress, their mood. We might open up a can of worms that we might not know how to deal with, or might not have time to deal with, because, as you know, doctors are seeing people fast and trying to be efficient. And often that efficiency works fine, but for chronic disorders, we do need to take a little bit of time. And I think, it's interesting. It's a process of re-educating doctors and patients so that the patients are learning that these questions are important. Because sometimes I get pushback. What are you trying to say? I'm crazy? Why are you trying to say it's due to my stress? Why are you saying it's because of the way I eat? It's something else. And doctors get pushed back if patients want to ask a lot of questions about something that they don't know about. So it's re-educating patients to know that everything is important, not just one organ cut out of the body and set aside, and doctors to realize that too. And unfortunately, what we also need to go along with that is a medical system that allows us to work with a multidisciplinary team that can assist, because I may be able to get people a little bit of ways down the line talking about their diet, but nowhere near as far as a really good registered dietitian. So I work at UCLA with a team of fabulous dietitians who, when I've gotten to my limits, can help me get patients the rest of the way there. And it makes everything work better. When I get to my limits of being able to work with a patient on what should we do for stress reduction, I can teach people some simple breathing exercises. I can direct them to resources. But if we need a little bit more help, I work with a nurse practitioner, Suzanne Smith, who does mindfulness training. I work with a psychologist who can do cognitive behavioral therapy and hypnotherapy. And so we're really fortunate in our center to have everybody in one place. And it's a rarity, but I think it's a way that people are realizing medicine needs to move, because it's big. It's not something that one person can necessarily handle. In the old days, when we used to pretend that we had that silver bullet, that silver scalpel, and we could make it all better with our medical training, we thought, okay, we could go out there and do this on our own. I think it's really clear that approach has not succeeded in medicine. We need a multidisciplinary team in medicine, and we need our patients to know that we can't fix things with a cut or prescription pad.
Well, that's what our society wants, a pill for every ill.
Yeah, a pill for every ill. Well, I always say to my patients, I'm not holding back on you. Any of them that see that will recognize, if I had that pill, I would, and it was a safe pill, I would give it to someone. But in most cases, certainly in complex GI symptoms, that's not always the case. Now, I'm all for using what I call integrative medicine. So using all of the amazing tools we have in Western medicine, biologic drugs and surgeries and sophisticated procedures that can help us diagnose and treat illness. We've done that really, really well. But what we are just learning to do better is all of the stuff outside of that, where integrative medicine really helps us, where acupuncture may be helpful for pain for someone, whereas taking a pain medicine, whether it's something like ibuprofen or whether it's an opiate, both of which are Tylenol, all of which can have significant side effects and morbidity, and also don't work very well for some things. So we need to have those things when we need them, but maybe also I may need to know how to place some simple needles in the body that can relieve pain as well. And then patients need to realize that sometimes they've got to do something too. It's not passive. Getting out there and making some changes that may be a little tough is what's going to help in the long run. So I always try to have, what's our short-term plan? What's our long-term plan? And the long-term plan really for everybody, very few of us have achieved healthy eating, healthy living, healthy minds, healthy spirit. We can all, it's a continuous path for all of us. The more we're moving in that direction, the better we tend to feel.
That's great. So these mind-body interventions, can they benefit all GI disorders, or are particular ones better for particular disorders?
Yeah, that's a great question. Most of the research has been done in irritable bowel syndrome because that's an area where it's very common, about 10% of the population. There's some that has also been done in disorders of upper gut, we call it functional dyspepsia, and just a little bit in inflammatory bowel disease, which is quite different and is treated medically. So we need medications for that, and sometimes even surgeries for that. But there's a little bit of data that shows that people might do better with that, with mind-body interventions as well. And the reason for that is the mind-body interventions are going to, they're going to help deal with, one, the distress of having chronic discomfort and pain. So part of our pain is what we feel in the nerves. Part of our pain is how we interpret it and how it impacts us. You know, there's the old saying, you know, pain is inevitable, but suffering is not. And so if we work on that suffering piece, it turns out it impacts those nerves and decreases pain. So pretty much anyone with pain can have improvements in suffering. But then we also go to, what about things like the motility of the gut, the immune system of the gut, the microbiota of the gut? And we think that we probably are making headway there. There's a few studies that look at hypnosis and actually changing the cytokines, the inflammatory chemicals in the lining of the gut. There are studies showing that meditation can change inflammation, can bring down inflammation in the body. And so there's a rationale that's biologic for how these mind-based things can actually improve gut health. As a side to that, when we feel better and we're suffering less, we also tend to make better decisions. And so we may utilize the medicines at our disposal more wisely. We may be more likely to avoid things that aren't healthy for us, like smoking. We may be, less likely to use other drugs that could be damaging, and we tend to be more willing to eat better. But when we're suffering, hard to change habits that may be adversely affecting us. So it works on multiple levels, from biologic to psychological to really practical.
Many of the mind-body interactions I've heard you talk about, like acupuncture or hypnotherapy or meditation or mindfulness, they seem to be things that are very relaxing that I've seen people use for other things, like, for example, anxiety reduction. So is there a connection that something that would just calm you would just be good for your gut?
Yeah, I mean, I think there probably, yes, but there is, I think, a difference. So people will say, well, I just like to watch TV. How about if I just watch TV? Or I'm just going to listen to music. They've actually studied some comparisons between listening to relaxing music and doing hypnosis. It turns out there probably is a benefit to anything that brings down the stress level. But interventions, particularly interventions that seem to change the breath and how we breathe, along with our cognitions, how we interpret things, to do that together seems to be what can change the outcome. And there are very few other relaxing things that do those things together. People will say, well, I like to burn off steam. I like to go for a run, or I like to go for a gym, and that makes me feel great. And I'm all for that. But what seems to help pain and anxiety, and really pain is what we're often treating it with in the gut, is something that that combines relaxation, slow abdominal breathing, and something that helps us shift our thought process to one that is really present moment and not thinking about how I might feel in a minute. So I feel something in my stomach. Okay. But if I feel something in my stomach and then all of a sudden I go to, oh, what's it going to be like in a few minutes? And am I going to have to stay home from work? And if I stay home from work again, my boss is going to be really mad at me because I'm out of sick days and I could lose my job. And I remember the last time I felt like this, I was home for 3 days and, I couldn't make dinner and my kids got really angry at me. And all of a sudden, I mean, just saying that, my GI tract was a little disrupted, right? I mean, it just goes right down there. And so in addition to just feeling good and relaxing, we need to do something that allows that whole process to be diffused and allow us to just feel how we feel. And we may not like it, but we can accept it for what it is and deal with it, rather than bring in all of the baggage from the past and all of our worries from the future and have that affect our body and how it's working. The gut just starts churning. And that affects the little microbes that live within it. And that can get rid of our probiotic, our good bacteria when we're under stress. And it can lead to this vicious cycle of symptoms. So yes, do all the enjoyable things that make you feel good and relaxed or good and activated, but also something that really does focus on how the brain processes things.
So are you actually saying that stress and worry can actually affect our microbiome?
Yes, absolutely. There are a number of studies looking at animals and how animals that are more stressed have a shift in their microbiota. There are definitely studies in humans looking at depression, showing that there's a shift in their microbes as well. There are studies in people who have irritable bowel syndrome that show changes. And it's an area that is really advancing the science. We know that if we give someone probiotics, certain probiotics, and then look at how their brain functions, we saw that the brain function changes in people who took probiotics compared to people who didn't. And there have been a number of studies, in addition to the one that we did, years ago now. So we know those connections are there. What we don't know is the details. So for you, what we know is with your microbiota, it really comes from usually the mom, but definitely the upbringing, what diet you ate, how many antibiotics you got, what you were around, right? And it's like a fingerprint. It's very, very individual. So for you, when you get stressed, you may have a shift in your microbiota that loses some bifidobacterium, which are some of the good bacteria in the gut. Whereas I may have a shift that loses some lactobacillus, which are another type of good bacteria in the gut. And when we lose those, we have a whole nother set of bacteria that now can flourish. And maybe in me, it's a bacteria that makes a lot of gas and slows down my gut and I might get constipated. Whereas in you, it may stimulate the gut to secrete a lot of fluid and your gut goes really fast. And these things change over time. And so it's one of the explanations for why people will say, well, how can I, with irritable bowel syndrome, how can I 1 week have normal bowel movements and another week I have diarrhea and another week I have constipation and I'm eating the same thing all the time? Well, every day is different. And the combination of food, mind, environment, all of the things that kind of go into making us feel the way we do it any given day, it's changing all the time. And so the gut responds. And in some people, it responds very vigorously. Whereas in others, they may get headaches, but they have the cast iron stomach. They may have trouble sleeping, or they maybe get back pain. There are their body works in a different way.
That's amazing. So how important is it what we eat for our optimal gut function?
It's essential. It's the one most important thing that we can change, because we can't change our upbringing or the microbes that our parents gave us. Like, that stuff is there. But what we can change is what we put in, what we feed ourselves and all of our gut microbes. And what we know about that is we know that a diversity of fruits and vegetables, a lot of whole grains, not much animal products, if any, and really no processed foods, which is unfortunately a lot of the diet that people are eating in this country because it's accessible and inexpensive, but really upsets the gut. That's what's going to be the most helpful. And while I'm not a dietitian and I don't have the detailed knowledge to give people very sophisticated diets, what I do know is that if you can't recognize what that food is by reading the label, probably shouldn't be eating it. You know, eat simple, eat whole foods. It doesn't have to be complicated. You take fruits, you take vegetables, you take some seasonings that you can identify, and you make something with them. And, you know, I eat a delicious diet without having, I don't eat frozen foods, things that come in a box or a bag. That might be something I have as a treat, but that's not what I want to put in my body as my basic. I want to be able to identify those foods. And if I don't have time to make them, I just eat them raw.
So I imagine that fiber is important.
Oh yeah, fiber is very important. So fiber is a prebiotic, is what we call it. It's the stuff that we don't digest, that the bacteria in our colons use to create energy. And they break it down and they use it to create nutrients that we can't make, that we're going to utilize. And it also keeps the fluid within the stool and allows it to move through nicely. And people will often say, oh, well, what fiber supplements should I take? I like to start with, well, let's see, what are you eating? Because, you know, 25 to 30 grams of fiber is our lower level of normal. And almost none of the people in this country are actually getting that. So we got to get there. And it's not from eating salad, because that's the most common answer. Well, I eat a lot of salad, but the salad doesn't have that much fiber. So we want to look at all of the things they're eating. Are we getting up to that point? And if not, we want to put foods in to get up to that point. And if once we got foods in to get up to that point, so we filled you up with some good healthy foods, then we can start talking about supplements. Because if you eat not such a great diet and then say, you know, most people, when I get there, I say, try some psyllium fiber, natural psyllium fiber. If you put that on top of a really processed fast food, terrible diet, you're just going to get a lot of gas and a lot of bloating, and it's not going to create the change we want. And then you say like, oh, fiber doesn't work. Well, it doesn't work on top of McDonald's. It just doesn't. But it does work if it's done in a careful way.
Oh, that might be my favorite quote from the summit. Fiber does not work on top of McDonald's. We should get a T-shirt that says that. That's brilliant. How do things like hypnosis and acupuncture actually affect the GI tract?
Mm-hmm. Well, there's some studies with acupuncture, which I think is simpler, where they've actually shown very specific points on the body change gastric emptying times, so you can speed up the emptying of the stomach by using certain points. And in constipation, certain points that actually increase motility through. So we know that by stimulating these points that were identified thousands of years ago, by doing that, we're activating the nervous system. And by that nervous system activation, we're changing the way the gut moves. There may be some other ways that they work, say, secreting different things into the gut. But we know, at least in terms of the motility, that it does that directly. With hypnosis, it's really interesting. Study that we did looking at brain activation in people who had bowel symptoms. And we did a study that sounds a little bit odd, but it turns out people who have a sensitive gut, if you blow up a balloon inside the gut, They feel it really intensely at a much lower level than the average person who is healthy without gut symptoms. And so we did this study where we blew the balloon up in healthy people and in people who had irritable bowel syndrome. And we looked at the brain, and we looked at how the brain responded. And what happened is with the healthy people, part of the brain called the prefrontal cortex, the part is sort of our regulatory part of our brain, came online when we said, soon you're going to feel this pain. We're going to blow up the balloon, you'll feel this pain. This regulatory part lit up. There was parts of the brain that actually sense pain and how process pain. Those lit up a bit, but not much. And then when we deliver the balloon, those sensory areas lit up, but the patients felt pain. Okay. The people with the irritable bowel syndrome, we said, okay, you're going to feel this pain soon. That regulatory part, it didn't light up. And before the balloon even changed, the sensory part that shows that pain is happening, boom, lit up. The insula, which is this part that processes pain, that brings it to consciousness and decides how we feel, boom, lit up. The balloon has not moved. And they look like they're in pain already. Blow up the balloon, it doesn't even change. The brain has already processed the pain. Like I said, that record that you pull out of the jukebox and play that memory of what pain is, it's already there in people before the pain happens. But then you use hypnosis, which is, yes, it's relaxing, but really it's remodeling our thoughts and our nervous system reactions to life. Do that once a week for 8-10 weeks. We put them back in the scanner, and the people with IBS look just like the healthy people. That regulatory part of the brain was like, oh yeah, the pain's coming. I better light up and get ready. It didn't light up in advance. It wasn't preparing for it. It changed the way the brain responded. And by doing that, there's a whole extra layer of the brain that otherwise would be sending all these signals to the gut. Go faster, slow down here. Our stress response in the gut is to slow the stomach down. That's nausea, vomiting, bloating, and speed up the distal colon, the rectum. That's, oh, I got to go to the bathroom. Oh, I have cramps. So that stress response, hypnosis blunted that. So the brain really can control how the gut works. It doesn't just control how you feel about it. It controls how it moves, how it secretes fluid into it. It controls the immune cells that are sent there and how they react. And that's going to be, we talked about changing the microbiota. So hypnosis and acupuncture have real biological effects. They aren't just something that like, oh, you're relaxed, so you're complaining less. They're changing what's going on.
That sounds amazing. Because you also mentioned meditation. Hypnosis and acupuncture sound great, but when I think about meditation, I'm thinking like, oh my God, I'm going to just have to sit there for 20 minutes and do nothing.
Well, there's a beautiful study that Helen Loretsky at UCLA did looking at 12 minutes of meditation and cellular health. And so it turns out that maybe all you need is 12 minutes. And who knows, maybe for some people it might be 7. For others, it might be an hour. So it doesn't necessarily have to be a very long time. It has to be long enough and sort of intense enough to break the hold that the world and your worries and stresses have on your body. And so some days that might be really quick. So for me, I meditate regularly. Sometimes if I just sit in my meditation posture, all of a sudden I feel so much better. It just puts me again, it pulls out a much better record to put in my jukebox. Pulls out a record that says, I feel good. And today is going to be a good day, right? So it doesn't have to be a long time. But when we're in a lot of stress, we just feel how you feel at the end of the day that's been rough. You know, the body is tight. Often we'll be, you know, like kind of hunched with the computer. We'll be like the hunchbacks coming on. all of those body signals are like telling us we don't feel good, and the gut feels that. And so you may get into your meditation posture, and the worries are coming, and the worries are coming, and you're like, oh, I'm trying to focus on my breathing, and everything's going. And it might take longer. And some days you might not even be able to release the hold on your body. But with practice, just becomes an easier record to pull out and put on the player. I don't know what a modern analogy is. A TikTok. It's a TikTok dance. Is it better for your body than that other one that you were watching? It just becomes a different pattern. And so I think for many people, meditation is the hardest one because it feels like you're sitting with nothingness. But when you train with an experienced practitioner, so mindfulness-based stress reduction is the most evidence-based of the meditation practices for anxiety, depression, irritable bowel syndrome, chronic low back pain, post-traumatic stress. It's very structured, and it doesn't leave you hanging. It says, we're going to do these things together. It's 2 hours every week for 9 sessions, and you have homework, and you know what to do, and you practice these things. And eventually, over the course of practice, it takes hold. You know, we know what you practice grows stronger. So if you're practicing tension and beating yourself up and never letting yourself relax until you fall asleep, that's what you're going to be stuck with. We got to intervene, and we have to practice feeling calm, feeling relaxed, visualizing positive things. And then we're going to feel better. So I'm never going to say that it's easy. But for all the people who say, oh, I can't do that. My mind goes too fast. I can't meditate. Well, okay, maybe just sitting and meditating to start with isn't the way to do it. But most people can do it within a group setting, or they can do something like Tai Chi, which I have a lot of my patients do, where you're not just meditating, but you're moving at the same time. And some people, you need to keep the body moving and moving slowly. And one of the magics of Tai Chi is people will say like, oh, it's too slow, I get impatient. Like, that's the point. You need to slow down the body and then slow it down some more. Because if you can learn to move the body really slowly, the brain loves that, and it makes it feel relaxed. So all these, there's so many, this is the joy of it, so many different things that you can do. And there's a different one that's going to work best for each individual. The key is to be open-minded and not to jump ahead and say it's not going to work.
Do you find that your patients are open to these body-mind interventions? Because so many people with GI problems have had them for years, whether it's chronic constipation or IBS, and I imagine they do take some time to work.
Yes. I mean, it's easy for me. People come to me because this is one of their interests for the most part. But even when I see people, you know, sort of that weren't really coming for any particular integrative medicine approach, most people are pretty open to it. I'd say the most difficulty we have is finding providers to work with them, finding time, quite honestly, finding money, because their insurance will pay for me. They'll pay for me to do all kinds of endoscopies and tests, but it's not going to pay for them to do Tai Chi. It should, but most people, some insurance will, particularly a capitated system where we're paying for the whole person, because it's going to be cost effective in the long run to do all of these things. But for many of my patients, it's not that accessible because it's a carve out from insurance. And so I try to work with people to find things that they can do low cost. I mean, using the phone, there's an app for everything. There's plenty of meditation apps out there. Some of them quite good, some of them not so good, but you know, people practicing and hearing different voices, going to YouTube. I love to go to YouTube and do Tai Chi with different instructors and find different things that people do. We have access to so much. So even when we don't have access to a one-on-one provider or even a group, which is often still quite expensive, there are things that we can do.
It just sounds like even people that don't have GI disorders would benefit from these modalities, because we're living in extraordinary times right now with so much stress that we didn't have before.
Yeah, so it's a huge stressor and a trauma to, the globe. And so this is a time where I in particular talk to my patients who have time a little bit of carved out. They used to have that hour commute. They used to have that extra hour they had to get dressed and put on their makeup or, tie the tie. That they're doing things from home. It gives people a little bit of opportunity. And so in the darkness of all of this, I think it's really important for us to use this for whatever opportunities it provides. And it provides us often some time to separate from people who may be giving us more stress in the external world. It allows us to go internally and to give ourselves a little bit more time to sleep and to be thoughtful and to meditate, to potentially have a spiritual practice if that's something that people want. It gives us some more time to think about what we're eating, because we're preparing it for the most part in our homes, because people aren't going out as much. So as stressful and difficult as the times are, they also, I think, allow us to potentially make changes that when we were on our treadmill of life, we just weren't able to do. We didn't allow ourselves that time. And now if people have that time, it's absolutely a time to utilize it. And I've heard that back from people where they say, it's funny, I thought I'm really stressed about this, and I thought it would flare my symptoms, but it's not. I'm actually doing much better. And it's a great thing to notice when you're forced to stop and hop off that treadmill that we do like to be on frequently. We can actually allow the body to settle and feel healthier. So definitely let's all take that opportunity, because there's so many other parts of it that are driving us all crazy.
Yeah, that's great. I once heard you say that exercise changes what's going on in the gut. Does it have to be vigorous exercise like running a marathon, or is even gentle walking or yoga good for the gut?
Yeah, well, I think yoga is great for the gut because it allows twisting and bending, and it focuses on meditative breathing. And that abdominal breathing from yoga is what tells the gut that everything is okay and allows it to settle down. So yoga is fantastic. But when we get back to gut health, is really overall health, right? It was kind of where we started. Getting exercise, regular exercise, does seem to help the gut microbes. We don't know the mechanism by which that happens, but people who exercise have a more diverse gut microbiota. And in general, even a simple exercise program like walking, we've shown that can help irritable bowel syndrome. So whether for one person, a vigorous exercise might be a walk around the block. I have some patients where that's not even achievable. Their vigorous exercise may be seated, but really moving the arms and legs and twisting and moving the body. I'm a big believer in diversity generally as being good for our health. So it's diversity of the diet, diversity of movement. We sit in this chair. I say to my patients, you do this all day long, right? We walk, we run, we type. Yeah, maybe we reach something and we reach down to get something, but we're not doing a diversity of movement. And that's where there's a reason why yoga and Tai Chi are ancient practices that have continued for thousands of years, because they have health benefits. And it's really a diversity of movement, stretching, flexibility, all these things within our potential are the key. So it's not a one size fits all. When I'm 100, I'm going to be still doing some yoga and Tai Chi, but it'll probably look a little different than what I do now. And that's okay. That's what's right for my body, right? It's just as just as damaging to have someone whose body cannot withstand a hard workout, a punishing workout. You know, the person who's my age, in my 50s, I go to the gym and work out too hard. This is where we get knee replacements, hip replacements, all these other problems. So I'm not saying go out and punish yourself. It should be, it should feel good and be good for you.
Yeah, that's great. I know you've done a lot of research. Could you please talk about some of the results in your MSBR research?
So in the mindfulness-based stress reduction, what we showed is that, like others have shown before us, that this simple intervention of learning to, basically just learning to be in the present moment without judgment, reduces symptoms in about 3/4 of the people who do it. And in what we showed was that there are different aspects of that that may be more important than others. And so the thing that seemed to be most resonant was acting with awareness. So there's different components of being mindful. And so acting with awareness, rather than going on autopilot, seemed to be the most important feature of mindfulness that led to better symptoms. We're now looking at the brain results from that study. And it's really interesting. We look at people who responded to the mindfulness and people who didn't. And those people who responded to mindfulness developed a whole slew of new connections in the brain, before to after. Their brain was much more connected to other regions of the brain, really communicating. Whereas the people who didn't respond, they either had less connections or no change in those connections in the brain. So the brain stayed in its same song that it's playing, rather than opening up to all different possibilities. So really, it's why I love brain imaging research so much. We have ideas from talking to people and learning from people of what we think is going on. And then we can actually watch the mechanisms of how that happens. And so I probably didn't need to have the brain to show me that after a mindfulness training, our brain is more awake and alert to everything around us, rather than before, when we're just focused on our internal ruminations and thoughts. But it's very powerful to see that in the data. It's really supportive. So hopefully those results will come out soon as well.
That is fascinating. When a patient is open to trying these mind-body interventions, do you direct them to all of them or one of them? Like, how would I decide? Do I go for hypnosis or acupuncture or Tai Chi or meditation, or do I just try all of them?
Yeah, well, I think that most people will have, if I give them a little sense of what they are, they either come with some biases or they come with some interest. And I think the most, I'm a person who listens to my gut. If it seems like a good idea to you, that's the one that I'm going to pick. There may be some data that's a little stronger in one thing versus another thing for the whole population. But if you say, this sounds like I'd like to do it, that's the one I want you to try, because I think it's the most likely that you're going to actually do it. And you'll probably be benefit. And often people might start with one thing and we may branch out and add something on. So often we might start with a movement intervention because which there's less data for pain and for IBS, but there still is. We might start with that because it seems the most accessible to someone, for example, who fears sitting in one place and being with their thoughts. So we might start with a movement intervention. And when they realize, oh yeah, that's feeling pretty good, we might say, okay, well, let's do something that is really, really more brain focused, whether it's cognitive behavioral therapy or mindfulness or hypnosis or one of these other things. Whereas other people just like the idea of something passive, to be honest. Hypnosis, I'd like to sit in a chair and have somebody do that to me. And really, hypnosis is not doing it to you. All hypnosis is really, the work is done by the person with a guide, but it feels like less work, I think, to some people. And so that might be the way you want to go. Whereas someone else might be hypnosis. I don't want you controlling my mind, which it doesn't do, but it makes somebody uncomfortable. I'm not going to go with that as my number one thing. So what we have available to us, what we think is interesting, you know, do everything. I mean, that might be a little bit too much, but I think, again, diversity is so important in all aspects of our life. I like to add things on. And sometimes I may be more, some points in my life, I might do more of one than another.
They all sound great, actually.
Yeah.
Acupuncture sounds the best to me right now. If I was going to choose one for some reason, yeah, that just sounds very relaxing. And again, I just have to lay there. So
right, it's true. Whereas for me, the idea of the needles, I'm a little needle phobic. So it's something that took me a while to get used to. I had to treat a lot of patients to feel comfortable giving it myself. So yeah,
that's interesting.
Yeah, it is. It's about our own biases, interests, and putting those together and deciding a really personalized plan for each person, and not just assuming just because the data shows acupuncture is good for this, that it's necessarily the right one for everyone.
Yeah. So I work with people trying to get them to eat healthier. And one of the reasons they say they can't is because of these various GI issues, which is the reason I wanted to produce and host this summit. And the number one symptom that I get people telling me that distresses them, even worse than constipation, which is horrible for the people that suffer with them, is this abdominal distension. It's not just women, it's men. And we're not talking about the sensation of bloating, but where they look like they're pregnant and they feel so bad. Is there any kind of a more immediate relief? Because I'm sure that these modalities, they don't work immediately on the bloating, do they? Because people are always saying, I can't eat fiber, I bloat, I distend.
So the distension is a fascinating thing, and it's a very tricky one to treat. And it's not as common as the sensation of bloating, which is also really uncomfortable. But the distension is an abnormal reflex that the body has. And basically it feels like it just got so much stuff in it, it needs to make space. And so it actually rearranges the muscles, the diaphragm and the muscles of the abdomen to make space for that huge meal that you didn't eat. So I have patients who will say, I drink a sip of water and boom, it's out, right? And so we know that's not normal physiology. That's something going wrong. It's basically a reflex that's gone wrong. And so we try to improve it by reducing things that are triggers if we can. We sometimes will use medications to increase the motility to try to move things through. We sometimes use medications to blunt the nervous system response. But in the long run, remodeling a reflex is remodeling the nervous system. And so it is something that for some people may take some time. But I have to say, it's not, I've not found it in my practice to be very fiber specific. It may be one of those things people think about, but it seems like it can happen with almost any food. So I wouldn't blame fiber for that one. But like I said, we have to be really careful about how we use fiber. You know, it doesn't get rid of all the problems in the diet. It's something that really is it should be a foundation that we're building all these healthy things around. It shouldn't be an air freshener over a great big mess.
I'll never forget that you can't add fiber to a Big Mac and hope to have your health back. That's my biggest takeaway. Dr. Tillich, what are your best tips for people just in general to promote optimal GI health?
The key basics. So whole food, plant-based, healthy diet is a great way to start. Working on stress reduction. Not feeling like you have to wait to fix your whole life and everything in it, but realizing that you can change the way you and your body respond to the stressors that may be inevitable around you. So some kind of meditative or relaxing practice. Physical exercise. I mean, really, they're the things that if I happen to be an endocrinologist and you said, how can I best, manage my diabetes or prevent diabetes? They're going to be the same things. Heart disease, they're going to be the same things. These are the ways we can prevent the majority of chronic illnesses in our country, whether it's musculoskeletal pain, heart disease, cancer, diabetes, digestive dysfunction, mood disorders. These affect all of them. And so if we can build that foundation, everything else that we do is going to be a lot easier. Choosing maybe a medication now and then, choosing a supplement now and then. But if we don't fix those basics, we could pour every supplement in the world on top. It's still not going to feel good.
It sounds like what you're talking about is the foundation of health, and that what's good for the gut is good for every part of the body.
Absolutely.
Yeah. So, Dr. Tillich, what is the truth about GI health?
Well, the truth about GI health is it's just as easy as it is hard, I guess. The things that we need to do to create GI health are those simple things that we all kind of already know, but most of us have a lot of trouble doing, that we just talked about. If we can build a foundation for health generally, our GI health is probably going to fall in line. And those aspects of it that may still be problematic are going to respond much better to conventional medical therapy.
Great. Thank you so much.
No, you're welcome. Happy to talk with you. It's been great.
Wow, I love this doctor. Actually, I mentioned earlier that I did see her in 2015. I was referred by my regular doctor, who was a GI doctor as well. Dr. Pimentel was a specialist I had seen specifically for the SIBO. And when I went to her, boy, she was as compassionate as she is brilliant. And hopefully you enjoyed her talk. And what was really interesting is she had sent me to a class. That was her treatment. No medication, no procedure. She sent me to I think it was 8 or 9 week mindfulness class at UCLA that was taught by Suzanne Smith, a nurse practitioner that is part of the multidisciplinary team at UCLA. You'll hear from her in the summit, and she's the one that made the video that will help you if you have abdominal distension, and it's linked to in the summit. And it was amazing. And she is amazing. And it was funny because I couldn't get her on the summit. She just said, "Oh, I have nothing to add." When she heard who the other speakers are, absolutely, because she's the only one that talked about what she talked about. And I'll share with you some of my favorite moments and key takeaways. And she just reiterated what some of the other doctors said about these diseases, especially the functional GI diseases, that for GI health, there's no test. It's not like your blood pressure or your cholesterol. There's no test to see if you have optimal GI health. There's no x-ray. And so you have to decide, how do you feel about how your gut is doing? And she talked about how GI health, it improves our overall health. And that is the key to our well-being. It's not just about the gut. It's about this overall health concept. And she talked about how she built this multidisciplinary team with GI doctors, nurses, mindfulness experts, registered dietitians, psychologists. And that is what we have built on this summit. You are going to hear from psychogastroenterologists and all kinds of experts. And if you are suffering, you can go to a place like UCLA where you will see all these people. They'll all be part of your team. And now with the pandemic, it's never been easier to get a telemedicine appointment because they've loosened some of the restrictions and can do it in other states and other countries, whereas they couldn't before. And Dr. Tillich has actually performed a lot of research looking at the brain with functional MRI and showing how these modalities actually affect and improve the gut. Acupuncture changes your autonomic nervous system. So does yoga and mindfulness. And it changes and remodels the brain. We can't always just give a pill to make things better. I know that's what people would like, but it's just not always possible. And that symptoms are not always generated from the GI tract, but from the brain. That was fascinating when she talked about the jukebox and the record. And that how none of the targeted drugs for IBS even worked because they didn't address the root problem. The brain, the gut, and everything that we put in the mouth. You know, she mentioned that medicines can reduce symptoms, but they are not the cure. The cure is diet and lifestyle. healthy eating, healthy habits, healthy living, and healthy thinking. She said everything is important, not just this one organ that we know is the gut, and that she can't fix things just with a cut or a prescription pad, that we do need, many of us, especially with these complex GI symptoms, a can't say that word, multidisciplinary approach. And that's what we're trying to give you on this summit. And she said that people do better with these mind-body interventions, especially if they have chronic discomfort and stress, because it works on the nervous system to decrease the pain. She mentioned how pain is inevitable, but suffering is not. And I love that, because when you're suffering, you don't make good decisions often. And that hypnosis can change the inflammatory cytokines in the lining of the gut. I mean, that's amazing. I actually do go to, not hypnosis, but acupuncture, and she's a medical doctor here. It's amazing the effects it can have on you. And that meditation can bring down inflammation in as little as 12 minutes a day. Everybody's got 12 minutes. And she said what helps pain and anxiety is the breathing and the relaxation and the present moment thinking. And anything that helps the brain process stress is going to affect our good gut bacteria. And this will shift our microbiota. That is amazing, if you ask me. She said what we eat is essential for our gut function, because it's the one thing we can change, what we feed ourselves and what we feed our gut microbes. We can't change our past or what happened to us or even our stress necessarily, but we can change what we eat. And she recommends either all plants or at least mostly plants and no processed food. You know, she said if you can't identify the ingredient on the label, you probably shouldn't be eating it. And perhaps the most profound thing she said, and maybe one of the most profound takeaways from the summit, is you can't throw fiber on top of a McDonald's diet. It's not going to work. So you can't have these bad habits and a crappy diet and just expect a pill or a supplement to be your panacea. She said that acupuncture shows specific points. There are specific acupuncture points that help change the gastric emptying time and increase motility. So that could actually, it's been proven to help with constipation. And I thought it was mind-blowing, the balloon experiment she talked about, how the brain processed the pain even before they inflated the balloon. And that hypnosis and acupuncture have real proven, in the research and the scientific research, biological effects. You know, she says what you practice grows stronger, and we all need to practice to feel calm and relaxed if we want to feel better, especially if we have these chronic GI disorders. And unfortunately, she said insurance will pay for her to do an endoscopy and a test, but not for Tai Chi. And that we need to really change the way things are, because this will help. And Tai Chi is for people that can't sit still and meditate. Tai Chi could be a wonderful alternative because it's meditation in motion. She says that exercise changes what goes on in the gut, and the abdominal breathing in yoga will tell the gut that everything is okay. And I do yoga every day, even if it's only 20 minutes, and that the twisting in the yoga poses actually will help our gut. And she says that people who exercise actually have been shown to have a more diverse microbiota. And we're going to learn why that is important, the diversity. And she said even walking can help IBS. Let's see. So yeah, we want a diversity of movement and a diversity of plants in our diet. And she says there's a reason that yoga and Tai Chi are ancient practices that have withstood the tests of time and lasted thousands of years, because they work. We want to learn to act with awareness. And she said we need to remodel the brain and remodel the nervous system. And that's what these techniques can do. And even if you don't have gut problems, we're living in very stressful times. These can help everyone with any condition, especially chronic diseases. So she says whole food, plant-based diet, stress reduction, physical exercise. And she says we can't always control our stress, but we can learn new ways to respond to the stress. And she says this is not just for people with GI disorders. She says this is for people with all chronic diseases. Thank you so much, Dr. Tillage, for a wonderful, wonderful conversation. So next we have a trio of doctors that work together. They actually wrote a book together, and they'll talk about gut health at every age, from childhood to senior. Their names are Dr. Lawson, Dr. Del Pozo, and Dr. Latifat, and please welcome them to the summit.
Dr. Del Pozo, Dr. Lawson, and Dr. Latifat, welcome to the GI Health Summit. Thank you all so much for being here.
Thank you for having us.
Can't wait to talk to you guys. So I'll start right away with the question. Why does it seem like food is the culprit for symptoms of irritable bowel syndrome? And can we change this to actually using food as healing?
Jess, go ahead.
This is a great Dr. Lawson question. Got motility and
Yeah, sure. Well, when we put food in our stomachs, we generate lots of reflexes that are either hormonal or nervous induced. And in irritable bowel, those reflexes are amplified. And so patients tend to see these foods as an enemy, something that's going to cause cramping or bloating or gas or diarrhea because of these heightened reflexes. And part of it is the way they're wired. They're wired differently, as Dr. Del Pozo knows better than I do. They have a way of allowing way too many nervous inputs into their brain, and this creates a shutdown and this heightened reflex activity that causes all the misery of irritable bowel syndrome. And we found that it was very prevalent in children, and we found that if we could intervene and somehow stop that information overload by working on stress, exercise, education, diet, and sleep, we could make a difference. We didn't cure anybody, but we attenuated the symptoms so that they were much more livable.
Because, you hear a lot of times little kids often have a tummy ache. And so how does a parent know, well, is it just something they ate, or maybe it's something more serious and they need to see a gastroenterologist?
Absolutely. It's very important for them to make sure they're working with their doctors as parents. And a lot of us, actually all of us on the video today are parents. So we definitely understand that the impact that our kids being distressful can cause on the parents. And you're always wondering if it's something horrible or not, right? So when you work with your doctors or your healthcare team, whether that's a nutritionist, mental health, and they've done diligent work in making sure it's nothing dangerous, it's really important to understand that the GI tract is the second brain, right? We spend a lot of time, our body spends a lot of time in digestion. We cannot live without food, right? So the bottom line is our GI tract is constantly working, and that can be in adults and also in kids. And, like I mentioned, it is the second brain. So things like stress can affect the GI tract. Not sleeping well can affect the GI tract. Our mind work can affect the GI tract. So again, it's important to make sure you work with your healthcare team. But really all those things external to the body can cause GI symptoms. And we really have to take a bigger view of wellness to make sure that ourselves as parents and kids are healthy.
You mentioned diet, sleep, and exercise. And like when I was a kid, I never heard those words. I'm 60, by the way.
Different times, right? You look fabulous.
Oh, thank you. But Dr. Del Pozo, kids, it seems like it's more stressful to be a kid today, just in general.
I would say so. And it's hard. It's hard for parents to know, right? How much screen time is too much? How much structure is too much? And it seems that the combination of little structure, a lot of screen time, the habits of eating, you can enter from anywhere and get improvement. A lot of criticism with a lack of structure can be a difficult combination. There's so much stress with parents being together, apart, together, and in conflict, changing schools. Just going to the school lunchroom can be a really intimidating place to try to digest food for a kid, even if it's not a new school. Skipping breakfast is very common, and then really overeating and binging on delicious junk food after school is a common pattern that we've seen with the kiddos.
I don't know what it's like because I don't have kids, but when I went to school, they didn't even have doors on the bathroom. And it's like, how does one feel comfortable even going to the bathroom when there's not a door? Do they now have doors on the bathrooms in schools? Because they didn't when I was growing up.
As far as I know, yes, but it can still be a scary thing to leave class if other kids know that you're leaving because you have diarrhea or you need to use the bathroom. And so we try to encourage in general when school is in session that kids go to school with a tummy ache unless they have other symptoms like a fever or something else where their primary care doctor is saying they should stay home. But if it's kind of recurring tummy aches, you take that pain with you and you carry yourself gently through the day, lots of breaks and making it easy and supportive for them, but keeping them in their general routine. If something is really distressful to them, on occasion, they need to talk with someone about that and make bigger life changes. But most of the time, we want them to stay plugged in and just increase their coping skills.
I mean, it's hard enough being an adult with GI disease, but to be a kid, it must be really difficult.
And we found that in our program that when we got the kids together, we have groups of, say, 6 to 8 kids. It was very reassuring for them to look around and see these normal-looking kids with all the same problems that they have. And I'll never forget one little guy said to his mum in front of me, "Hey, Mum, I don't feel like I'm a freak anymore." And I think that group therapy is very powerful.
I know that in adults, often one of the symptoms of IBS, and sometimes if they have SIBO too, is bloating. Does that often also manifest in children? Because I could imagine that could be embarrassing. And, kids are not always nice to other kids. They tease them. And, because I've seen adults bloat men that, like, when they have an episode, they look like they're 9 months pregnant.
That's a great question. And interestingly, kids don't tend to bloat as much as adults. Maybe their stomach muscles are tighter, who knows, but they mainly complain of nausea and maybe throwing up and diarrhea as well. And it's interesting that this condition is very, very frustrating because it doesn't show up. It's like a migraine headache. It's very real. There's no question about the symptoms, and we never question the symptoms. We reassure the kids that we understand that they are suffering and reassure the parents despite the fact that all the tests are negative.
When I think back, before, we had functional medicine doctors, I can imagine so many kids were just told, "Oh, you're just nervous. It's in your head. You have a stomach ache." And they were dismissed just the way many adults were dismissed early on.
You bring up a very good point, which is it's not a question of whether it's in their head or not, because we know it's not in their head, right? We know that the body is powerful. We know that our nerves are powerful. And even though we cannot see it as physically as the arm, doesn't mean that it's not there. And it definitely plays a huge part in the impact of the symptoms and also the burden of how significant it feels in the lives of the people that are affected. So I agree with you 100%. It's not in people.
And we have some catchphrases that we teach to people in the classes. It's not in your head, but your brain has a lot to do with it. How you're taking in and processing information. And it's very real, but it isn't life-threatening. And so the reassurance comes that it isn't life-threatening, and we can do a lot being uncomfortable. In fact, it's better if we stay engaged in our daily activities, paying attention to our symptoms, but not letting them rule the entire day.
Right. As I mentioned, I was born in 1960, and I didn't grow up eating the best diet. That's when a lot of processed food was coming into play. Remember, Space Food Sticks and Tang and Pop-Tarts and all these processed foods. And it seems that kids today eat even worse than I did. And schools do not always serve healthy lunches.
Yeah, absolutely true. And we found that, the kids, as Dr. Del Pozo said, they tend to skip breakfast, and when they get home, they gorge on pizza and Coca-Cola. You couldn't imagine anything worse for the GI tract. Fat is a much more potent stimulus of a lot of these enteric reflexes that we talked about. And these kids have a very sensitive GI tract. We use the term visceral hypersensitivity. Simply put, that means if you put a balloon inside the intestine of someone with irritable bowel syndrome, they'll feel that balloon at half the volume. And in experimental situations, when you add stress, you don't even need half of that volume to cause the same amount of discomfort. And so these foods, especially high fructose corn syrup foods, tend to generate a lot of gas. And most of us can handle a bit of gas, but when you've got irritable bowel syndrome, it feels like a ton of gas, and it doesn't move as readily as it should. So, these types of approaches to diet have generated interest in this diet called FODMAP, and we could talk a little bit more about that perhaps, but it has had some benefit in a lot of irritable bowel patients.
My understanding, though, is you cannot follow the low FODMAP diet forever. That even one of the doctors on the summit said that long term it could actually cause nutritional deficiencies.
That's absolutely true. And I think only half the people stick with it. And that's why we took a more sort of multifactorial approach to the kids. Yeah, we include diet in the program, but we also stress, sleep. And thankfully, Dr. Del Pozo is an expert on sleep, exercise, and education is very important, giving the kids credibility, knowing and sort of appreciating how they feel.
The dinner table can be a really stressful place where everybody's home from work and home from school, and there's kind of an amped up feeling sometimes, and everyone's maybe wanting something different to eat, but the pressure comes with, how was your day? How was the test? Rather than just being in the moment and, focusing on how we eat and setting up the scenario rather than the TV on in the background, having, pleasant, relaxing music and having it be a calm place to digest. It's often a real point of contention for families if they're even together at that time.
Many of the experts on the summit saying that fiber is really important for the gut microbiome, and yet so many kids today eat not just few fruits and vegetables, but none. And I believe Congress now said that ketchup was a vegetable, they can put it on their French fries. And so a bigger question is, how do we get kids to eat these healthy foods, whether they have GI disease or not? Because this is so important.
I think a lot of it starts at home, like Dr. Del Pozo was saying, at the dinner table, and what options are being made available, right? And what our concept that we're teaching to our kids as good food is. I was reading a book recently that had pictures of yummy foods versus yucky food for little kids, and the yummy food included things like pizza and juice, right? So it's what kind of information are being extended to our kids directly, but also through parenting. And I agree that fiber is great in general. However, there are different forms of fibers, right? Things as simple as adding spinach into their smoothie can go a long way, right? So there are things that don't necessarily have a horrible taste. And also when it comes to taste, it's acquired, right? When we teach our kids that eating things that are high in sugar is what delicious is, their brain gets a message that is delicious. So a lot of it definitely start at the dinner table and even breakfast with parenting, and how we can definitely influence our kids' palate and what their definition of delicious is and what educational materials we're exposing them to. I think that's really
I agree with you. Taste is acquired, and that's why it's so important for mothers to get their diet in order before they even have the kids, because people that eat healthy love eating healthy, and it is often sometimes more difficult to change the palate, but it's possible. And I love your idea of the smoothie, because this stealth approach to hiding vegetables in foods, like putting more in marinara sauce with familiar foods, it can actually help. You had mentioned visceral hypersensitivity, and I remember hearing about this test. It's so interesting to me. I would love to have it, because I've suffered from IBS for years, and I always say I'm like Princess in the Pea, where like I feel things more deeply. And I'm wondering, with the children with the IBS, in addition to this visceral hypersensitivity, do they also have just sensitivity in general?
They do. In fact, it's very common to see migraine headache, and in adults we see TMJ, fibromyalgia, as well as poor sleep patterns and fatigue. They sort of come together as a jigsaw puzzle. Everything starts to fit. And it's just because it's not just the gut that's on information overload, it's the whole body. And the whole body is very sensitive. And what was interesting, I was a bit surprised that in kids, we don't quite see the whole gamut of those things, but we often see some of them, migraine being very common amongst kids with IBS.
Interesting. Can somebody request this test? And I'm wondering how, and the people that don't have IBS, why would they even want it?
I have a sigmoidoscopy without any medication. That'll tell you you've got visceral hypersensitivity. Yeah, Dr. Latif is laughing, but I'm 70, and I remember days when we used to do that test, and you could tell who had irritable bowel, AJ. It was very obvious.
Just going to add a note to what Dr. Lawson was saying. And one of the terms that we like to use is allostatic load. So it's kind of looking at the whole picture of this child in their family, in their community, in the world at this time, and what's going on in the background. What's the whole picture going on with this person, rather than trying just to look at the mechanics of one person's gut. We want to look at everything going on around them.
I'm thinking if a child has to be on a special diet, and we're bombarded with so much dietary advice this day, not just low FODMAP, but gluten-free, paleo, keto. And if a child does have a GI disorder and has to be on a special diet, I could imagine they might feel different. And especially if there's other children in the family or at school, they're not getting to eat those same foods. So it must be difficult to explain this to a child that wants to eat like their friends.
Yeah, that's correct. And I think it's important to state that there is no specific diet that fixes IBS. FODMAP diets are just designed to reduce the gas in the intestine. That helps. And, you're right. It's very hard to comply with these strict diets. They don't last for very long. So, and I think what Dr. Del Pozo is saying, it's often the setting in which you're eating that controls or produces these symptoms. And again, that's why we took that multifactorial approach, not just focusing on diet. And I found over time that patients can be a bit more liberal with their diet once they get all the other things under control. The stress, the exercise, the sleep. They're important factors to treat when you're trying to get someone to get better.
Right. Well, in your book, The Gut Solution, your book, which is for parents of children with IBS, you talk about the placebo effect. Why is this important? What is it, first of all, and why is it important?
I think, well, let me let Dr. Del Pozo explain. I think she has a good way to do that.
Placebo for years was kind of referred to as a fake effect of, from a fake sugar pill or another phony intervention of some kind, surgery or something else. But really, it's a real response to something with an inactive ingredient. And there's an old MASH episode about that using morphine, which worked for about half of the soldiers, on the MASH unit who they ran out of medication. And it's something, how we can kind of sum up what we understand about it is when help is on the way, or when we feel that we have agency in our life and we can take some kind of control, or we're taking something that can help us, the smart brain body starts to shift immediately into more of a healing place. And so it's a real response to a so-called, faux intervention. And we're all susceptible, to it. And that's a good thing. It ruins plenty of pharmaceutical clinical trials for medications because placebo often works almost as well or as well as certain medications. But it really is pointing at the natural ability of the body to shift and refocus and heal itself.
So talk a little bit about the gut microbiome, why that's important even in children, and how can they optimize their gut health?
Well, let me let Dr. Latifat say a bit about that.
Yeah, gut microbiome it's very complex. And I believe it's actually a blessing that we sometimes think to not be a good thing, but it actually is, because your gut microbiome affects how certain vitamins in your body is broken down. And we're having more and more data, and we need to learn more. We'll continue to learn more about truly what the impact or the consequences are, right? But we know that there are certain things that affect your gut microbiome. There are things like your diet, things like stress, things like sleep. All of those affect your microbiome. What you're eating affects your microbiome. We know that when we're leaner versus when we're on our heavier set of our normal, there's a difference in our microbiome as well. So it's really, really important to understand that. And it's not just the microbiome causing issues or health issues, but it's also all those things actually impacting our microbiome as well. So making sure we're getting our prebiotics, our fiber, those are all important. Helping our body have a good balance of bacteria using things like probiotics if needed and if indicated can also be important, right? So I always tell people that when we have things that are not meant to be our body, but we're feeding our body with it, that can definitely cause imbalances. That doesn't only affect our GI health, but also other parts of our overall health.
What should we be teaching our kids about gut health?
We should be teaching them that good health is about our diet, it's about our sleep, it's about our being outside and running and being well and interacting and fighting and having conversations and just understanding that life is not perfect, right? Because what we know is that we talk a lot about the brain-gut connection and the impact that our brain has on our health. And when our kids understand that it's normal to not be happy all the time, that actually affects their GI health. When they understand that things that are high in sugar doesn't mean that it's good for you, that actually impacts their health. Knowing that, having issues and having conversations at the dinner table and how to conflict resolve, that all affects our GI tract. And I remind people, and Dr. Lawson is smiling because I cannot tell you how many clinic visits we have where people have abdominal pain when they're fighting with their spouse, right? Where, people have abdominal pain on Monday mornings on their way to work, right? So all this if there's anything I would recommend that people take away from here is the fact that our GI system is not this isolated island where you're talking about your GI tract being well. Your GI tract being well is a reflection of your entire health being well, your mindset, your work-life balance, your joy in life, your giving, and all these other things that are just as important as anything else you get in my clinic. So.
I love that what you said about how they have the stomach ache Monday morning. I can think back to the one job that I absolutely could not stand my supervisor. And I had a stomach ache the entire time I worked there. No doctor could have helped me. That's
What's
great.
interesting about that, AJ, is when we try to have classes during vacation time, kids would never show up. They showed up as soon as school started. And that's one thing to add to what Dr. Latif had said is that we are role models as parents. And studies have shown that the more mum goes to the doctor, the more the kid will go to the doctor. And I think it's very important that we show good health to the kids, and they'll tend to follow us.
When I was little, we actually went outside and played and we got dirty. And now today, everything is super sanitized. And I heard that's not necessarily a great thing for our gut microbiome to be this clean all the time.
I think there's some truth in that. For example, peanut allergy is a good example where in Israel, where kids are given peanut butter at a very young age, they hardly ever develop peanut allergies. And the Israeli allergists can't believe how much we see peanut allergy in kids in Western society.
Yeah, one of the patterns that we see is this avoidance, avoidance of a certain food or avoidance of food altogether. And because it seems like it's causing distress, and really it's just kind of that tip over the edge that the body's having a hard time digesting because of everything else going on. And like the peanut allergy example that Dr. Lawson gave, we don't necessarily want to avoid something because it seems to cause harm. We want to just look at it more carefully and be curious about that. We don't want to avoid school because school is stressful. We just want to look more closely at it and, kind of look at all the factors that might be contributing.
I'm wondering if the pandemic in general has been more favorable or less favorable for people with GI diseases, because for some people it actually has created less stress and for some people more.
I will agree with you 100%. Definitely people that are more sensitive have been struggling a little bit more just because of the mental and mindset part that the pandemic has been inflicting on people. However, in people that have stressful work environments, this is the best thing that's ever happened to them. So it's a mix for sure.
Absolutely, because my job used to require me to travel all the time, which is something that I never enjoyed. And so this has been very good for my gut, but obviously not for everyone. So what's the best treatment for IBS in general? And does it matter of the age if it's a child or an adult, or is treatment pretty much the same?
Well, I think it's a great question. And I think, again, the multifactorial approach seems to be the best approach. If you look in the literature, what we did and what people have applied to adults is equally effective. Medicines, as Dr. Del Pozo alluded to, are limited because the placebo effect can be present in about 40% of patients. Now, to get a drug through the FDA, you only have to prove the drug works in 50% of patients. 10% better than placebo gets you, through the FDA and onto the market. And a lot of these drugs have side effects, and many of them are hellishly expensive. The only drugs that I feel are really great benefit are the ones that help you sleep, that aren't addictive, and that can block some of these pain pathways that Dr. Del Pozo alluded to. But again, if you look at the old data, education and reassurance is very, very effective. A study done in the Mayo Clinic many, many years ago by Nick Talley showed that when the doctor took time to explain the condition and its relationship to stress, those patients had less depression, less abdominal pain, less likely to call back and less likely to come back. And I think this doctor-patient relationship is vital. Just sticking scopes in people and telling them they don't have cancer is no way to treat this condition.
I think it needs a better name because people don't like things that have to do with, stool or bowel. I think there needs to be like a PR firm that like kind of rebrands IBS with a better name. And I think patients might be able to accept the diagnosis better,
Well, functional bowel disorder is another way to explain it. But when you say functional, you're sort of implying you're imagining this. It's not real. I don't think that's a good thing.
Yeah. It's just, I find anything that has to do with pooping or bowels, or if people they just are embarrassed, they're ashamed. At least in the adults I talk to, a lot of times they don't even go to the doctor. Even constipation and in diarrhea, especially, these are embarrassing things. And people, that's one of the reasons I'm doing the summit is I'm trying to make pooping like normal. I'm trying to normalize pooping, especially for people that don't have normal poop.
Yeah, well, about 30%, up to 30% of the adult population have had episodes of incontinence. And it's very prevalent in patients with irritable bowel syndrome. And it's important to address that and ask the patient if that is a concern, because this keeps them at home and makes them depressed, and there's ways to treat that. And I think that's an important issue to bring up with patients, even though it's uncomfortable to talk about.
The part of the magic of the class is someone who isn't here. Monica Randall was a dietitian that taught with us. So we really had this multidisciplinary approach. And she was so good at putting everyone at ease and talking about poop and farts and, just putting it out there. And once we kind of could shine a light on it, so to speak, it really did destigmatize it. And I do think that you brought up a really important point, and that you taking the shame out is so important to move toward healing and not making people more anxious. They're already kind of prone toward anxiety, and now they have anxiety about anxiety. It kind of doubles the problem.
I mean, especially now with it being so prevalent. What are broad strokes?
The broad strokes of wellness, we really are, it's summed up in the acronym SEEDS, where it's stress management, education, exercise, diet, sleep. And if we can add another S, it's socializing, it's connecting with others and finding our purpose, finding meaning in life. Those are the broad strokes.
What do kids do when they have a flare-up? How do you advise them?
And we mentioned it a little bit earlier, of just slowing down, but staying in their general routine. Having a flare-up plan where, on a really bad day, what are those things that are going to support yourself? Who can you call out to? Can you still go to soccer practice or something else, but maybe not go 100%, but just stay kind of plugged in and gentle with yourself, but continue through the day.
Just wanted to add to that. I don't think we can overemphasize the importance of parental education and also wellness for the parents as well, because the kids can feed off of the level of anxiety or anxious the parents are. So we find that the more well compensated in that way, quote unquote, the parents are, the more likely, the better the kids are able to do. So taking all that, but also really empowering the parents so that they can set the tone. Because what we're communicating is not just the words we're saying, but the unconscious messages that we're passing on to the kids as well. And this is a very important factor.
A lot of diseases run in families or are genetic. Do you find that's the case with certain GI diseases, especially IBS, that if a kid has it, it's often a sibling or a parent also has it?
Well, there was an interesting study with identical and non-identical twins done in Seattle. And what they found is that there was about a 20% concordance in the monozygotic twins. That means if you're a twin with identical DNA has IBS, you have about a 20% chance of having it yourself. However, when they looked at the non-identical twins who don't share the same DNA, it was more important if the mum had IBS than if the twin had IBS. So I think it just suggests that your environment is more important than your genes.
And what you believe about yourself, what you believe about, is it a catastrophe to have these symptoms or believing that it is something that you can learn to manage without dismissing it or catastrophizing, but finding that middle.
Is IBS the most common GI disorder you see in children, or are there others? And if so, could you talk about what some of the other ones might be?
We do see inflammatory bowel disease, and I'll let Dr. Latifa talk a little bit about that, Crohn's and ulcerative colitis, because sometimes they do tend to mimic irritable bowel syndrome, but usually it becomes pretty obvious over time what it is.
Yeah, I agree. In my practice, I see people over the age of 18. So by then, they're fantastic pediatricians, and GI doctors have already done a great job in making sure that there are no, there's inflammatory bowel diseases. Those are already ruled out at that age. But absolutely, IBS is extremely common. In fact, I tell people that we all have a level of IBS to an extent, right? If I eat something that doesn't go well with my body, I'm going to bloat. If I have stress in my life, I'm going to bloat. If I go past what my healthy range of normal for my weight is, I will bloat. So it's also part of it is remembering that it's our body's way of sending messages to us to try and change something. So remembering that the pain itself is not a sign of alarm, but could be a sign of, all right, maybe not this one, maybe not this time, maybe a little bit more rest. So we all have IBS to an extent. It's just more high burden in some people than others.
You mentioned about having a favorable weight. When I went to school in the 60s, maybe in a class of 40, there would be one overweight kid. Now it seems like at least 1 out of every 3 kids under the age of 18 is overweight or obese. How is that affecting their GI health?
Well, in general, it's more common in overweight kids. However, I had this preconception that when we set up this class that we were going to see a lot of overweight girls in the class, and that was not the case. We saw a lot of very fit kids, a lot of high-level soccer players, a lot of swimmers who competed at a very high level. And in fact, if you look at college athletes, the worst IBS occurs in rowers. So it's not the only factor. And exercise is very key to improving irritable bowel symptoms because exercise generates endorphins. These are our body's morphines that float around our cerebrospinal fluid and bathe our brain and block a lot of those pain pathways that give the discomfort that these patients suffer.
Some of those high-level athletes will work on reducing and managing perfectionism because they're at one end of the spectrum. And as Dr. Latifat said, we want to look at this as a spectrum, a continuum of health and disease that we all oscillate on throughout our entire lives.
When I was, I believe, in junior high, they stopped physical education in the public schools. And today, sometimes this is the only exercise kids get. I can't imagine that's good for their health in general or GI health in particular.
I agree with you 100%. It's not good for any one of us, kids or adults. In fact, when I take care of older adults in the hospital, we know that the less mobile you are, the more you sit down in one place, the weaker your muscle gets. Right? So it's really important for adults, kids, and exemplifying if the entire family is going for a walk. You're not pointing fingers at the kids. We're truly leading by example.
I've heard from some of the experts in this summit that most Americans eat something like 92% of their calories from animal products and processed food and less than 10% from fruits and vegetables, which means that most people on the standard American diet are on pretty much a virtually fiberless diet. And constipation is a big problem. And I see so many adults that have had constipation their whole life. Is having constipation as a child, can that set you up for future problems? Because I know that without eating fruits and vegetables, a lot of these kids are probably not having regular bowel movements.
Well, that's correct. Encoparesis is a condition that plagues kids where they're too busy to go to the toilet. They generate a big stool in their rectum. When they try to pass it, it's painful, causes fissures. They start to see a little bleeding. And those kids are definitely predisposed. However, this is a pervasive condition. I've worked in many places around the world, Cambodia, Nicaragua, Singapore, and you'll see it everywhere. And so diet is obviously a factor, but it's, there's more to it. And maybe it's just a big spectrum that we don't really understand yet. Maybe there's other, we could sub-classify it more than we already do.
Why do you think a multifactorial approach to treating IBS is the best approach?
Because it's the most successful approach. And the reason why, again, is we have to start defining our gut health as wellness. And IBS in general, it's a syndrome, meaning there's more than one thing in that bucket, right? So some people, it's more of the dietary. For others, it's more of the stress. And when I say stress, I want to make sure I'm pointing out that I'm not just talking about anxiety or depression, where people assume that if I'm not anxious, if I'm not depressed, I cannot have IBS. So not the case, right? When we worry, that can lead to changes in our microbiome. So definitely working with your nutritionist is important. Working with your psychiatrist or therapist is important. Your primary care doctor. But even more than that is just being active and being a normal, regular person in the society that understands and believes that life doesn't have to be perfect.
And patterns of brain activity are very similar in people with chronic pain issues like fibromyalgia or chronic pancreatitis as they are in irritable bowel syndrome. So there is a sort of a common pattern here. If you look at brain activity, there's areas that just let too much information through. And so the body gets on information overload, but it's not specific for the GI tract. And that's why, again, we see migraine headache, TMJ, fibromyalgia. All these things are very common in patients with irritable bowel syndrome.
And why exercise is so important, like you said, because if this is the only exercise, there's immobility in the body, but there's still stress going through the brain, and it has nowhere to kind of act that out physically. So movement is really key.
I've been hearing motion is lotion. So, yep.
We should talk a little bit about meditation as well, because we use that in our program with the kids, and self-guided imagery has a lot to benefit people with IBS. And there are websites and apps you can go on and learn that. It's a very simple technique to relax the body, and it really helped the kids. We gave them a CD-ROM to take home, and they played it to help them sleep, or they played it when they were having a flare. And that's one way to try and treat a flare, is to just relax and go to another level.
I'm learning from this summit that at least with adults with IBS, there's often other comorbidities. Sometimes there's hormonal problems or, hypothyroidism. In children, is that also the case, or is that just usually the first thing they get when they go to the doctor and don't really have any other problems?
What we found is that these kids go through what's called a crisis year. So when they actually present and are diagnosed with irritable bowel syndrome, they're having a lot of other visits, and particularly mental health visits. They were very prevalent. So and the kids that had more mental health visits were the kids that tended to continue to have IBS even after the program. So we had more success than the kids that had less mental health visits. But kids, were going to the ER and having CAT scans, and this is not a good thing for a young developing female to be irradiated, and we know in the long term this can be very harmful. So yes, I think, and what we do find with adults is that adults are 3 times more likely to have their gallbladders out, twice as likely to have hysterectomies, 50% more likely to have back surgeries. These comorbidities lead to a lot of interventions that they don't really need. And in fact, we probably see a mortality rate of about 6,000 people a year from unnecessary cholecystectomies, so gallbladder removals. So I think it's a real problem, and we have to see it in the big picture. It's a very expensive condition to manage if you go overboard with all these tests and unnecessary surgeries.
Like you mentioned earlier, it has a stigma to it. It doesn't have a flashy name that really can pinpoint how much someone is suffering. So I think it too needs a rehaul, and kind of have its reputation rebuilt to understand better what we're dealing with.
So I guess the question I'd like to ask on behalf of parents that are watching is, how do they know whether they should seek medical care for their child? I remember growing up, I'm from a family of 4, and it almost didn't matter what happened to us. I was actually hit in the head with a baseball bat, which today I would have had an MRI, but my parents, you're fine. Shake it off. It really, we never went to doctors. I mean, we could be bleeding. They just like, you're fine. That seemed to be the attitude back in the 60s. But so how does a parent know if a kid, maybe has a tummy ache because maybe they're nervous about a test, or a little bit of constipation or diarrhea, if they should shake it off, or when should they seek medical care and how often? And do they go to the pediatrician first? Do they go right to a GI doctor? So if you could just give advice to parents that are dealing with kids with tummy troubles.
I would say that if your kid is waking up in the middle of the night with GI symptoms, that is something that should definitely make you seek medical attention. If they're having diarrhea, they're waking up in the middle of the night with tummy ache, they're having bleeding. Those are definitely not IBS until almost never IBS. However, during the day when your kid is having abdominal discomfort or any of the symptoms we've discussed today, it's important to ask yourself and take a step back. Is there anything going on in our environment right now? Is there any changes going on? That's the first step. If there's a change going on, a new sibling, divorce, marriage, someone moving in, someone moving out, those can be some of the most common causes of symptoms in kids. And then really having conversations with our kids and teaching them the importance of communication, really getting down what's going on in school, what's going on in their social environment. And then going next to looking at the foods that they're eating. However, whenever there's a reason to be concerned, there's nothing wrong with discussing with your primary care doctor. Your doctors and your healthcare professional teams are really an extension. They're the ones with the training to help you understand whether this is just within that span of normal versus this is something that needs to be investigated further.
Yeah, and again, it's like a migraine headache. It's not going to show up on any test. And there are some simple blood tests that the doctor can do, such as a blood count and a test called C-reactive protein, which tests for inflammation in the body. And if they're negative, it's very reassuring, as long as the kid has no fever or weight loss. In addition, a lot of parents worry about sprue or celiac disease. It occurs in about 1 in 100 people, and there's a simple blood test to look for antibodies that might sort of allude to that. But it's no more common in irritable bowel syndrome than it is in the normal population.
What's the youngest patient you've seen with IBS? And in the case of a child, do they sometimes outgrow it, or do they have to look forward to a lifetime of suffering?
In our classes, we had an age range of 12 to 18 for the peds class. However, we often had people asking if their 8 or 9-year-old, 10 or 11-year-old could join. And we want it to be age appropriate, but certainly you can see, like many things, that we're seeing it in younger and younger kids. It's pretty common. Bellyache, is pretty common report, and then developing into the diarrhea, constipation, and altering usually comes a little bit later.
Right. Thank you. Could you talk a little bit about adaptability and what that means for gut health?
Well, it's adapting to your situation and attenuating the symptoms, controlling them with what you have in your power to do, such as relaxation and exercise and sleeping better. And I think, I think you made a great point. I really want to emphasize this. If you see a child with irritable bowel syndrome, you're seeing an adult with irritable bowel syndrome. I'm like Doc in the DeLorean in Back to the Future. I used to come to the parents and say, I'm not a pediatric gastroenterologist. I'm an adult gastroenterologist. But I'm here to stop your kid from progressing on. I'm not going to cure them, but I want to attenuate this condition by giving them tools to manage the condition. And once those tools are set into play and they work, that's something that those patients can use.
And helping the kids adapt in their environment, but also sometimes marriage counseling is part of the treatment plan, in the child's chart, that the parents are coming together where they aren't parenting different, where one is coddling or over coddling the symptoms and one is dismissing them. That's very confusing for the kids. So getting parents on the same page is a really important part of helping the child adapt to whatever they're going through at school.
When it comes to adaptability, I think a lot of children thrive on routine and structure. However, we have to also understand that we have to teach our kids how to transcribe and translate their systems from one routine culture to another routine culture. And sometimes what happens is when there's changes occurring, our ability to adapt to the changes that are external to us can also impact how much our GI health or how well our GI health does, right? So a lot of times we see people with GI symptoms when they're going through changes in life. That talks to our adaptability and our sense of that life is about 50-50 and not about perfection, and how to really translate and work on our mindset to help us adjust to whatever it is that's going on the outside, so that we're not internalizing it or viewing it as bad or dangerous or not normal. And so when it comes to adaptability, that's really important, being able to take oneself from one external environment or situation to another without impacting our sense of health.
You know, one of the things I keep hearing about in the summit is the overuse of antibiotics and how that's not favorable to our microbiome. And it seems that antibiotics are being prescribed more and more these days and to younger people. So how can the use of antibiotics in young children negatively often affect their microbiome? Is this a good idea unless it's absolutely necessary?
It's a bad idea, and there is some evidence that may predispose kids to Crohn's disease in the future, although long-term studies are always difficult to analyze. But having said that, yeah, you do mess up the microbiome, and there's a condition called Clostridium difficile colitis, that there's an overgrowth of bad bacteria that occurs in patients that take a lot of, and not everybody, but a lot of patients that take antibiotics, and it's treated with fecal microbiota transplants. I've treated the patient with that, and it's very effective. So I think, I don't think it's good, but we don't know. I mean, I see the microbiome as the universe. We're just starting to prod up to about Mars right now, and there's a lot more that we need to know.
In adults with IBS, you often see a concurrence of SIBO. Is that also common in children?
In my experience, no. Again, I'm an adult gastroenterologist. SIBO is kind of a little bit less popular than it used to be because the tests for SIBO are very unreliable. They're breath tests, and they can be affected by a number of variables such as transit time and proton pump inhibitors like Prilosec. So I think it's hard to sometimes interpret the results. And, I think it's a little bit over-diagnosed. People say, it occurs in up to 89% of IBS patients. And some studies have never been able to find it in irritable bowel patients. So I think it's a factor, and it may be a factor in people who have what we call post-infectious IBS. These are people who go to Mexico, come back, and they've still got the diarrhea weeks later. Maybe they're the people that can, are susceptible to SIBO. And if you treat everybody with IBS with SIBO, you'll get about a 48, if you treat everybody with IBS, assuming they've got SIBO, and there's a drug called rifaximin to do that, it only works in about 45% of patients.
I don't anticipate a lot of children watching the summit, but if one was and they had GI distress, what would you say to a kid?
That routine that Dr. Latifa spoke about, and all the exercise and meditation that Dr. Lawson mentioned. But also one thing we haven't mentioned is bowel training, where they wake up in plenty of time for school. Many of them are in the bathroom for a lot of that time. And so spending a little time regularly in the morning, having breakfast, doing something enjoyable, training themselves to go to the bathroom in the morning rather than kind of holding it throughout the day. And setting that up to be a relaxing place where their body learns what to do at that particular time of day can be part of the routine that helps.
So if you each could please answer this question and take as much time as you need, and whoever would like to go first, that's fine. What is the truth about GI health?
I would say that the truth about your GI health is that your GI health is not your enemy. And when you're having your GI symptoms, it may feel like it's the center of your world. It may feel like the only important thing that's controlling your world at that moment. But I encourage you to take a step back for a second and say that I have this life that's a gift for me. And if my GI health is this way, how can I live my life and still make it the best ever? And I think that's something that I want to make sure I pass on to people, where our GI health is not a burden to us or a curse, but it becomes part of our story, not all of our story, so that despite it, because of it, we can live our best lives ever.
Thank you.
I don't have too much to add to that. No longer seeking one answer to the problem of IBS and really looking at all of these things we've been talking about. We so badly want one pill or one surgery or, something that explains it all with one word. And we don't have that. We have something better that you can enter through a lot of different doors and end up improving your gut health and improving your general health.
Thank you. Dr. Lawson, would you like to finish it off?
Just reiterate what both ladies have said. I think that it's important, as Dr. Latifa said, not to make this the main focus of your life. We see patients that just ignore other things going on and affect their relationships because they're so focused about this bowel issue. And I think it's important not to ignore it, but to manage it, put it in its place, attenuate it to the point where it's, you know, it's always there and always will be there, and it will flare up in certain times. Accept that and just work on the things that control it, be it, you know, diet, exercise, sleep, stress management. Come to know the things that make you feel better and make your gut function in a relatively normal way.
And stay connected to the people that you trust. You know, for kids, talk to a trusted adult. If that's not your parents, it's someone else, and the family or friend. It's talking to other kids. It's staying connected and not isolating.
So there is hope that both children and adults can learn to manage their GI distress. Thank you so much, doctors.
Thanks.
Thank you.
So we do apologize for the sound on Dr. Latifa's part. She was conducting her interview from the hospital, and it was such a good interview. We did not want to do it over. We assure you that is the only sound glitch in the entire summit, but hopefully you heard them all right. You know, we know that there's probably not any children watching this summit, but we'll probably have many parents. And I know that I have friends whose kids have IBS. So we did want to have the pediatric point of view, because what he said was profound, Dr. Lawson. And didn't you love his accent, by the way? I could listen to him all day. That when you have a kid with IBS, you have an adult with IBS. And I know that my problem started when I was very young, but you know, back in the 60s, they dismissed everything. Oh, it's just in her head. She's just nervous. Well, maybe I was, but I suffered a lot because we didn't have doctors like Dr. Lawson back then. You know, they talked about the visceral hypersensitivity that Dr. Tillich also talked about with that test, that people that have some of these GI conditions, they just seem to be more sensitive, and even things like migraines, and that they don't necessarily show up on tests and x-rays, but they are real, and that the reflexes in people with irritable bowel, they're just amplified. So we have to understand that about ourselves. And they talked about how there are hormonal or nervous induced gut reflexes in IBS, and that it's very prevalent in kids. And again, just like adults, diet, sleep, exercise, this is what you work on, what regardless of your age. And that, you know, when you improve your gut health, you improve your overall health, and vice versa, I would imagine. The GI tract is the second brain. They're all saying this on the summit. And so stress and not sleeping well, it can affect your gut. And the group therapy helped the kids not feel like a freak. So if you do have a child that's suffering, please consider getting them into one of their programs. I do think they might even be doing them virtually now with the pandemic. But it's funny how that they didn't show up with the programs during summer when they had vacation, but once school started, all the kids showed up. I thought that was funny. And, you know, they mentioned the eating habits of the typical American diet. Kids often skip breakfast and then they gorge on junk food, you know, after school. So it's not good for anybody's gut. Even if you're an adult, that's not very good to do either. And yeah, it's so interesting. I wish I could have that visceral hypersensitivity test, because the kids, they felt the balloon at half the volume. Incredible. And, you know, things like high fructose corn syrup, not so good. These are in a lot of the kids' foods. And it's interesting that the kids also, a lot of them also had migraines. So very interesting. And, you know, he mentioned, and like some of the other doctors, that there's just no specific diet that fixes IBS, which is why they too take this multifactorial, or as Dr. Tillich said, multidisciplinary approach, using diet, sleep, and exercise. And then when they're combined with a diet, it's just much more effective than just trying to get the diet to fix it. That said, I love what Dr. Chang said, that you got to find the right diet for your GI condition. That's why we have 4 registered dietitians on, and like I said, 3 of them can do consults with you. And they talked about medications being limited because of the placebo effect. I found that very interesting, but yet placebo often does work as well as medication. And I really think it's interesting that the more the mom goes to the doctor, the more the kid goes to the doctor. Maybe that was my problem. My mom was, I don't know if she was a medical hypochondriac, but she sure liked going to the doctor. Interesting that they have decreased peanut allergy in Israel, where they give peanut butter early on. And I've heard from pediatricians that that might be a good thing to start doing that. But very interesting. And the multifactorial approach, it's not just good for adults, it's good for all ages. And broad strokes is what they talked about, the broad strokes of well-being: seeds, stress management, education, exercise, diet, sleep, socialization is important for adults as it is for kids. And the doctor-patient relationship is also an important part of treatment. You're going to learn all about that from Dr. Drossman. It's actually the subject of his next book. And believe it or not, Dr. Drossman actually trained some of the GI doctors on this summit. Very, very interesting how so many of these people are connected. They talked about gastroparesis, delayed gastric emptying. And it's funny that they said that, not funny, but it's interesting that they said that kids had less mental health issues at visits when they went through their program for treating IBS. And there is a stigma to IBS, and it doesn't pinpoint how much a person is suffering. It's, it's one of those diseases. It's not like having a broken leg, and then so, kids definitely need to get help with their symptoms and with this disease. So if you're a parent of a kid with these symptoms, take it seriously, please, because it doesn't show up on the test like high blood pressure or high cholesterol. But it's unfortunate that they never outgrow it. And that's why let's start good habits as soon as possible. Breastfeeding, vaginal birth if possible. Obviously you can't undo that, but all the things the doctors are talking about. But again, it's going to just stick in my mind forever. If you see a child with IBS, you're seeing an adult with IBS. And it's funny how I said sometimes marriage counseling is needed. And we heard from Dr. Chang about how these early childhood experiences, in some cases, especially if they're traumatic and there's abuse, can affect the child's gut, which affects the adult guts. But kids thrive on routine and structure. I think adults do too, actually. And adaptability is often a symptom when we're going through changes in life. So he mentioned that rifaximin only works in about 45% of patients. So, even though it's a very good drug, Dr. Pimentel was talking about, it doesn't work for everybody. And, SIBO, as he mentioned, can be caused by post-infectious IBS, like he mentioned going to Mexico, which is where I actually got my food poisoning. But I thought it was interesting that the bloating isn't as prevalent as a symptom as children as it often is in adults. So at least they don't have to deal with that. But if you're dealing with IBS or SIBO or any of these, we encourage you to listen to these experts and find someone that can help you, because it's like Dr. Tillage said, pain may be inevitable, but suffering is not. And you're going to learn so many techniques that can help you. And, one of the things you have to understand that the GI problems are not a quick fix. You're not going to solve them overnight, especially if you've had them for a long time. But even if you got 50% better as a result of what you're learning on this summit, isn't it better than the pain that you're in now? So I think there really is hope. And again, diet, sleep, and exercise. And we so appreciate the comments that you're putting on the summit page and all the kind emails, and especially those of you that are supporting our work by buying the summit package, which includes a free buddy pass. So if you purchase it, you get the summit, they get the summit. It includes not only the video and audio downloads, but the written transcripts of every single interview, plus several bonuses that are going to help you heal your gut. So our final speaker of the day is Dr. Emran Meyer from UCLA, and he's written several books on this subject. And he's going to talk about how the gut-brain connection affects our cognitive abilities and disease risk. Please welcome Dr. Meyer.
Hi, Dr. Meyer, and welcome to the GI Health Summit. Thank you so much for being here.
Thanks for having me on the show. It's a pleasure to be back.
It's so great talking to you. Dr. Meyer, so many people I know, probably more people than ever before, suffer from some kind of GI distress, whether it's GERD or IBS or SIBO or chronic constipation. Why do you think this is so prevalent now? And more importantly, what can we do about it?
It's hard to say in terms of actual numbers. Is this basically just a greater awareness of people the general concept of gut health, which I think that's probably the reason. There's if you look at the statistics, I mean, these disorders have not increased in prevalence, certainly not over the last several years. IBS has been, for example, fairly stable in its prevalence. It only changes because the definitions have changed over time. So every time the symptom criteria are being modified, you get different prevalence numbers. But overall, I think GI diseases have been very common, affecting, as you said, every part of the GI tract, from your upper esophagus to the end of your intestine. And what has happened, a dramatic increase, as you probably have also heard from other people, is this awareness of gut health, a sort of a very general concept that different people associate different things with this term. So, there's this concept of gut health and gut inflammation and anti-inflammatory food. Like there's a whole new area that people like to talk about in terms of, diet and what they are concerned about. And so I see a lot of patients that come and not with a specific symptom of pain or discomfort, but they want to know what they can do to improve their gut health.
What can we do to maximize and optimize our gut health?
Well, so I think the first thing is you have to really think about what is that concept, that we didn't really use in the past that much. And so zooming into our gut, and you have fairly complex systems, or you have, the lumen of the gut with a lot of the food that we ingest, the waste material floating with trillions of microbes. They're not just floating there, they're separated by very sophisticated layer of insulation from the gut-associated immune system, which is just microns under the surface of the gut lining. And all these elements in the gut. So I've used a name that was proposed by one of my colleagues, Roger Little, the gut connectome. So the term connectome now is used for a lot of different things. We talk about the brain connectome. We talk about gene networks. So everything is becoming, is being viewed in this concept. So the gut is clearly a connectome. It's the close interaction between the immune system. The biggest part of our immune system is in the gut. The microbes, the endocrine system that's also located in the gut, and then the cells that actually, line the gut. So you have like 4 or 5, and also the enteric nervous system, the neurons in the gut. So you have about, 5 or 6 very important systems located in your gut that all interact with each other. They can't really be understood in isolation. And gut health is if these interactions are in a beneficial way for us, like they call it in science, the host. And a lot of things can go wrong in the system. You can have, so what has received the most attention in the last few years is the interactions of the microbes with the immune system in the gut. And, words are being used, which I try to avoid, like leakiness of the gut. People have been trying to actually create a whole syndrome, the leaky gut syndrome, which in my opinion does not exist. But what's important is these interactions play a major role in not just regulating the immune activity in the gut, but that kind of is conveyed throughout the body. If you get an immune activation in the gut, it typically travels into your fat tissue, making the fat tissue an inflammatory organ, travels into your liver, creating non-alcoholic fatty liver disease, and migrating to the brain. There's a lot of interest now that the long-term upregulation of this immune system, ultimately through the microbes, plays a role, increases your vulnerability for Alzheimer's disease and possibly Parkinson's disease, cognitive decline. And so gut health has become a term that really involves just about everything in the body. And I would say that the immune system, I mean, the microbes in the gut do a lot of things. You know, they produce neurotransmitters. There's tons of startup companies that are focusing on individual molecules that these microbes can produce. But I think the most important part that links it also to the diet is this close interaction with the gut-based immune system. And the microbes have multiple ways of influencing that, you know. So that's a big part in my new book that I talk about this. And it is fascinating, you know, so why would the microbes do it? Well, the microbes do it because what we feed them influences their behavior. The most important part of what influences their behavior and how they then talk to the immune system. So that brings us directly, you know, to your area of expertise. The food that we feed them, the diet. And so now we have this sort of, for the first time, a fairly easily understandable, I mean, for the lay public, easily understandable concept why the food that we eat is so crucial for our, not just the day-to-day health, but also for things like, you know, aging, cognitive decline, how healthy are we when we're 80 years old? Frailty has become a big issue. You know, this concept that we, in Western societies, accept frailty as a necessary association when we get over 75 years old is totally wrong. I mean, there's studies now that you can dramatically slow this process through diet, and the microbes play a big mediator role in this thing. So, you know, gut health is now an amazing topic. I mean, it's, for me being a gastroenterologist, I've never seen that kind of focus on the GI tract in terms of overall health and interest. And I've never had an interest really, even though, you know, I grew up in a confectionery family, several generation, and grew up with sugar and desserts and tasty things. I've never really had an interest in dietary aspects until, you know, I would say 7 years ago, where I realized how crucial a component that is of our health.
I'm so happy to hear that. And I cannot wait to read your new book, because this connection with the immune system sounds fascinating. And I can't tell you how much I appreciate that you talk about the importance of diet, because as you know, most doctors have gotten very little nutritional training in medical school. And some of them will say it doesn't matter what you eat, but clearly you feel that what we feed ourselves, which is what we're feeding our microbes, is important.
Yeah, and this One Health concept is quite useful. You know, when we say, so how do we determine what's a healthy diet? So you could say, okay, we can look at evolution. You know, what have humans, our ancestors, eaten and for millions of years, and has kept them healthy and you know, kept them procreating and multiplying. We can look at what the microbes, what's the optimal food for the microbes, you know, and there the concept that we can use is, you know, the microbes are part of an ecosystem. Ecosystems are determined, the health of ecosystems are determined by diversity and richness. And so now for the first time, we can go from these concepts of determining what is a healthy diet, you know, rather than saying, well, I come up with this new diet and write a best-selling book about this diet, and then a couple of years later, you know, it's gone. I mean, this, unfortunately, you know, this is sort of the negative, the dark side of the whole diet field for me. How many people are in this, you know, promoting non-evidence-based or pseudo-evidence-based concepts and diets and make tons of money. write bestsellers and manufacture supplements and praise them without any evidence. So that's the dark side. The bright side, the most exciting side, is that now we have these ways of really coming up. What is that the healthiest diet? And I think the consensus is clearly going in one direction. It is a predominantly plant-based diet. It's not 100% plant-based. So we clearly, we have evolved to have the omnivore potential. But I think the largely plant-based diet is, just writing the book and going over all the literature and the studies in areas like cognitive decline, Alzheimer's disease, depression, everywhere, the evidence is evolving. Okay, so somebody's on that diet, their microbes change fairly rapidly in a positive way. And people that are on a typical Western diet, they have a much greater likelihood of getting these diseases, and the microbes are deficient. So they're either starving or, So I think that's a really exciting time that, and I feel this is almost like a mission now that to counter all the fake science that's out there and try to convince people this is actually now for the first time we can establish a scientifically based nutritional science, which up to now I've always considered nutrition a sort of semi, at best, pseudo-scientific discipline.
Well, you've made me very happy with what you're saying, because I'm a big promoter of eating a plant-based diet or plant-predominant diet, or even a plant-exclusive diet if someone ethically wants to do that. And I read a statistic recently that Americans eat something like 92%, most Americans that is, 92% of their calories from animal products and processed food, which contain no fiber. Fiber is found in plants. So why is the fiber in plants so important to our gut health, to everything really, what you're finding?
Well, let me answer this a little bit broader way. So clearly fiber is one of the most important components, and that goes back to the kind of diet that our ancestors have lived with for certainly for the last 25,000 years, but even earlier. It goes back millions of years. That even the hunters of big game, they always had, like, I think up to 50 different types of plant-based foods in their diet. We know this today. And we know that our genes, it takes about 15,000 to 20,000 years before our genetic makeup can adapt to a new diet. So our current gene makeup is adapted to a largely plant-based diet. And so, we can't deny this. And the same, the microbes are more flexible, and there's two components, I think, with the diet, or probably three with the plant-based diet. One is the fiber. Clearly, it's got a lot of attention and, deservingly, and it's not just, one type of fiber. So if you eat carrots every day, it's not going to do much good for the health of your microbiome. If you diversify the intake of different plants and different fibers, there's tens, possibly hundreds of different types of molecules that make up fiber, then you challenge your microbiome, because each of those fibers need a different bug to process it. So you force your microbiome to expand its diversity, and that's really what you want. There are many of these, these undigestible fiber components are broken down into the general currency of the gut connectome, which is the short chain fatty acids, which have a wide range of benefits locally in the gut, but also, beyond the gut in the circulation. And so So that you could say, this is already enough benefit to increase the amount of short-chain fatty acid production. But then you also have another class of molecules, which are the polyphenols, which are often or generally mischaracterized as antioxidants. I mean, some polyphenols are antioxidants, but most of this antioxidant activity has always been determined in cell cultures or isolated, systems, not in the full GI tract. Most of these molecules are not absorbable in our small intestine, so they're also targeted at the microbiome. So so you have two components already that are not really aimed to be absorbed in your small intestine, but they go down further downstream, the end of your small intestine, the ileum, and to the large intestine, to the colon, the polyphenols and the fiber. So just these two components will nurture, is the optimal food for your microbiome. And then you also have, a high ratio of the omega-3. You have fats in plant-based foods. And fat per se is not bad. It's actually, pretty good if it's the right fat. And so this ratio of omega-3 to omega-6 fatty acids, that the high ratio that you get in plant-based foods, I mean, this is actually a lot of fat in plants, like, is healthy as well. Some of that, those fats are obviously absorbed in your small intestine, but they will also influence, which is another benefit, your bile acid composition. So whenever you need bile acids to absorb fat molecules, and these bile acids are produced, in the liver, secreted into your intestine, then they help to emulsify the fat that you ingested, so it gets absorbed. But then they get into your large intestine, and the microbes modify these bile acids to secondary bile acids, which are then reabsorbed in our system and get into the systemic circulation. Now, some of these bile acids, which is really important, have been implicated in cognitive decline, have a negative effect on the brain. And it's the ones that are increased with the consumption of these omega-6 fatty acids. So the animal fat will give you a higher proportion of these secondary bile acids with the help of the microbes that are bad for your brain, cause degeneration and inflammation in your brain. Whereas if you get the fat from plant sources, that's not the case. So these are, I would say, the three main reasons, scientific reasons. There's clearly also vitamins and trace micronutrients in plants, but in terms of the health and the relationship to the microbiome, I think the three that I mentioned are probably on the top of on the top of my list.
Well, I couldn't agree with you more that we should get our fats, whole food fats, things like avocados, nuts, things like that, much more than animal fat. Because I believe in one of your presentations, you talked about how a diet high in animal fat is unfavorable for our microbiome, and that you mentioned a few tribes like the Yanomamo and the Hunza who typically eat a low-fat diet.
Yeah, so those are the last, these tribes are the last remnants of these hunter-gatherers that, that predate the agrarian revolution 25,000 years ago. And pretty soon, nobody from this era of human evolution will be left, because there's only a few hundreds left of them. Unfortunately, the Yanomamas are exposed now, even now with the COVID-19 pandemic. They're very susceptible to, nobody talks about that, but that's, having been there, it sort of really affected me personally in a way. So yeah, these tribes, I can talk about the Yanomama, and I wrote about this in my book. They're surrounded, we lived with them, and they're surrounded by wild animals, and game and birds and fish, and they're very selective of how much animal products they eat. You know, it's mainly fish that they catch, and couldn't tell you the frequency now with which they eat meat products, but even the animals, the wild game that they eat has a high ratio of omega-3 to omega-6s. I should also say this, you know, the kind of meat that we eat in our Western diet, it's not just that it comes from animals, it's also how these animals are fed and treated, because that changes the ratio of these beneficial to harmful fatty acids in their meat. You know, up to the best tasting steak would have a 60-70% fat content, and most of this fat comes in the form of unhealthy fatty acids. So if somebody loves steaks and eats them 3 times a week, clearly that's not a good thing that you can do for your gut microbial health or for your brain health.
Well, you know, it sounds like what's good for the gut is good for the brain, and probably good for the heart as well.
Yeah, so that's another thing that I found intriguing, you know, working on my book. So we talk about in medicine, you know, modern medicine is specialized. You have a specialist for diabetes and for hypertension and for coronary vascular disease and neurologists and for Alzheimer's disease. If you look at the chronic, you know, which has been called non-communicable diseases, so the chronic diseases of Western civilization, there's a healthcare crisis they have not gone down in their prevalence. If anything, some of them have been going up. We don't talk about it, and we sort of view it as a success of medicine that fewer people are dying from them, but that's at the cost of billions of dollars of medications and procedures that we throw at it to just maintain people alive, even though they have these diseases. So, you know, a coronary vascular disease is a good example of that. It's not decreased in its prevalence, the mortality has decreased. And so we're used now in Western society, so we have all these experts for all these different diseases, but if you really look at it closely, they're all interconnected. It's, in my opinion, it's a big syndrome of chronic diseases that are just different facets of the same underlying problem, and it all goes down. Clearly, there's other factors like genetics, but it all goes down. You can identify in each of them a similar pattern, you know, which is the unhealthy diet, changes in the gut microbiome, low-grade inflammation, and then spreading of this low-grade inflammation to different organs. So you could ask, why doesn't everybody get all of these diseases? Well, that's where genetics comes in, or epigenetics, that if you have risk genes for Alzheimer's disease or risk genes for heart attack, and you have, you know, you're on this unhealthy diet, this is the weakest point in your overall system. But I look at all these diseases, they shouldn't be treated by specialists. Somebody should look at those and, you know, public health experts like Walter Willard, you know, sees it this way. But a lot of our specialists in our medical system are not, you know, that's how the medical system operates effectively by, you know, treating individual diseases with procedures and with drugs rather than, you know, changing the dietary habits or lifestyle habits.
Wow, that's amazing. What about people that are like on a keto diet or a carnivore diet? That can't be very good, well, for the planet for one, but what about for their gut microbiome? They're not really eating any fiber.
Yeah, absolutely. And it's an interesting it's an interesting question, the keto diet. So clearly there's evidence that in certain conditions, it's quite effective, you know, and what's probably best documented is intractable seizures in young children, you know, where a child has a seizure every few minutes. It's not responsive to medications. And it's been found that a keto diet can be beneficial in this situation. Another one is if somebody, you know, is morbidly obese and wants to lose weight quickly, but it's at the cost of starving your microbiome. So you always have to keep this in mind. It's not a long-term strategy. You know, it's and there's other strategies now. You know, there's the time-restricted eating, which in some ways gets your system also into a relying more on ketone bodies to operate. So if you don't put any food in your intestine for 16 hours, it's sort of perceived, you know, as a signal to switch to a ketogenic operating mode and your brain, and you will burn fat and, you know, generate keto bodies. But then in the 8 hours where you're eating, you should have a largely plant-based diet with all the other things that your microbes need. So you go into this oscillatory pattern, which is, you know, might be the healthiest. So I think in general, those people that promote the keto diets, I would say they're probably not aware of what they're doing to themselves. They love to talk about that it lifts their brain fog and it you know, makes them more effective. But if you think about what we know today, what this does in the long term to your gut health and to your brain health, you definitely wouldn't want to do that. And there was a recent film which you may have seen, Game Changers, which, I mean, there were a lot of questionable, you know, statements made in that film in terms of science, but I think it had a phenomenal effect. So some of my friends who are, you know, like extreme mountain climbers or outdoor people have actually, you know, become vegetarian after seeing this film, because they saw that, you know, what previously were card-carrying or passionate, you know, keto diet consumers, and were eating, you know, like Arnold Schwarzenegger, probably several steaks a day, you know, with this illusion that this is so good for your health. When they saw that these people have actually switched their diet and felt that they are equally effective and competitive on a plant-based diet, I think that's a good example to show how much of this whole keto thing is to a large degree in the perception of people.
Well, it's definitely not good for planetary health, I can tell you that. And what might even be worse than the keto diet is some people are doing what's called the carnivore diet, where they're literally eating only meat. And if fiber is as important as you say it is to all bodily functions, especially our microbiome, which I agree with you, how are these people even pooping?
Yeah, no, this is it's an interesting question. You know, I mean, part of your poop is cells that are shed from the lining of your intestine. Some of them are microbes, you know, but the bulk of your bowel movements comes really from undigestible components, you know, that retain water. And so yeah, you mentioned the planet. So this is again the One Health concept. You know, I think it's amazing to me. Probably 99% of diet books are written with only humans in the center of attention. That kind of attitude has gotten us into the trouble that the planet is in right now, including, you know, the COVID-19 epidemic that people think they can do to these wild animals whatever they want to do, and not thinking about the consequences of that. So this mindset of completely human-centric diet and what's good for us is a big part of the problem that we have today, and it will get bigger because the backlash that this report by from the EAT Commission, the Walter Willard was the senior author, the backlash that it got from a lot of people, including the food industry. Not surprising, if somebody promotes something that is against very strong lobby forces in Congress, the meat, the milk industries. It's not surprising that there's an uproar. And but I would recommend to anybody interested in this to read that EAT report, which is published in the Lancet, which gives you the clearest picture that what devastating impact. I mean, look at the Amazon. The main reason that the Amazon is cut down is so either farmers have more land to grow soybeans to feed cows or to have larger cattle herds. So what's happening there is not because they have a bad president; it's because of our dietary habits, and that's particularly the keto and the carnivore promoters.
Yeah. What about dairy? I'm interviewing lots of medical doctors for this summit, and particularly gastroenterologists, and most of them do not feel that dairy is optimal for health in general, but especially for gut health.
Yeah, dairy is interesting. So we recently published this blog post on my Facebook page and in my newsletter. So this is also built on this illusion, that a large amount of dietary recommendations by the USDA, consuming a large amount of dairy is good for your bone health and good for your, overall health. And clearly, what they recommend, I forgot the exact number now, is way above what's considered, healthy by some experts. And it's based on this wrong concept. I mean, milk is something that has evolved to nurture, newborn mammals for a relatively short period of time because it's the most efficient way to get a high caloric diet for initial growth into the animals and into human babies. So human breast milk, probably one of the most amazing fluids that's ever existed on the planet because it also has molecules in it that train or that program the gut microbiome. But the great majority of people and animals lose the enzyme that breaks down lactose, so the enzyme lactase, and that's a completely normal process. So, medicine or gastroenterology has made lactose deficiency a disease entity. Well, it's the default mode. It's the status, how a healthy person evolves, that we don't have the genes to produce to break it down as adults, with some exceptions in northern countries like the Inuits and Scandinavians that have always dependent on their animal herds and the colder climate. And so there's reasons that genetically they're different, so they can process it. But in general, milk products are just not made for adult human consumption. I mean, that's the bottom line. And thank God, we can see now this revolution in moving to plant-based milk products. I initially, I still remember the first time I went to the UCLA cafeteria and had somebody order this, this latte with this kind of plant milk, and I got this is crazy, latte and cappuccino is sort of synonymous with milk, but in the meantime, we've become big fans and promoters of these various plant-based milks. They also vary in their benefits, and it's a good example how you should evaluate anything that you eat or drink. Some are better for the environment, like pea milk obviously has the lowest impact on the environment. Almond milk requires a lot of water to produce. But all of them have health benefits over milk. That's pretty clear. You don't have to worry about indigestion, all kinds of IBS-like symptoms, bloating, and yeah, it's to me it's interesting how something like this, our attitude towards milk has been ingrained over generations in our minds by the lobby, and by and then how easily medicine and gastroenterology has created a syndrome, which is really not a syndrome, it's the healthy state, that you don't have lactase as a normal adult in most societies around the world. So
well, if I could jump through the screen and hug you right now for saying that, I would. So you had mentioned cappuccinos, and I'm wondering what effect do things like caffeine and alcohol have on our gut health and the microbiome, especially somebody who's compromised with some of these conditions like GERD or IBS, because so many people, Americans in particular, start their day not just with one cup of coffee, but with several, and end their day with several alcoholic beverages. I mean, can that be good for our gut, especially if we have something like IBS or GERD?
Well, so if you have food sensitivities and something like GERD or acid production plays a role, plays an important role. Clearly, you want to be careful, with acidic drinks or something that we know increases reflux. Tea is better. Green tea is probably the best because it has this very high amount of beneficial polyphenols, and there's many studies now, large-scale studies that have shown that health benefit. With alcohol, I think it's so this is something when you look at different cultures. I mean, if you come from Europe, obviously alcohol is part of the social fabric. Be it wine in the southern European countries, be it beer in the northern European countries. And, the amount of alcohol that people in these countries consume would be considered being an alcoholic here. It's always intrigued me to see that, in doing medical training. I think the consensus is that in general, for various reasons, the amount of calories, being one of the top, factors, and the consequences in genetically vulnerable individuals of liver disease. I think alcohol in amounts beyond small to very moderate amounts is definitely not good for our health. In America, in many ways, we have sort of thrown out the window that you think you can get your calories by eating your hamburger in the car and listening to music. That's definitely not what food is intended to be, a social bonding ritual, which I have experienced. I've had several meetings with a good friend of mine, Marco Cavalieri in Italy, who I mentioned in my book as well, and maker of wine and very special olive oils. And I've seen it firsthand, how his workers after work get together with him, sit down, have their meal, or for lunch. It's always associated with the bottle of red wine, obviously. And so if you experience that, and so, many Americans experience this. They go on vacation to Tuscany. They love it. Then they come back and they forget, okay, so a big part of the healthy Mediterranean diet is really these social interactions with people.
Yeah, that makes sense. Well, do you think maybe Americans are more stressed than the people in Tuscany? Because I remember reading in your book that chronic stress can really affect the gut microbiome.
Yeah, that's another sort of angle, and it's fascinating that chronic stress can do many of the same things to the gut connectome, so the immune system and the microbes, as an unhealthy diet does. So if you're chronically stressed and you're on an unhealthy diet, it's the worst possible scenario. because you amplify, you know, the insult that that you do on your gut health.
Well, what can we do about it? Like, for example, I always think exercise is a great way to counteract stress. Does that have a positive influence on our microbiome as well as our anxiety?
Yeah, so this is interesting that you bring this up. So some pretty good studies now that have shown that moderate exercise has a beneficial effect. It does all the things that you know, that a healthy diet does, and that a low stress state does. But if you go to marathon runners, the story changes. So extreme athletes, endurance athletes, particularly if they're genetically vulnerable to that, they develop the opposite pattern. So it's low-grade inflammation, increased permeability of the gut barrier. This will affect secondarily the muscles, probably also the brain. There's no studies on that, but so with exercise, maybe similar to what we talked about with coffee and alcohol, in moderate amounts, it's health promoting, and we can see this in the beneficial effects on microbial function. If you go to the extreme, it turns into the opposite. So you could take this in as a you know, like a general rule. But it is really interesting. You know, people have also found, to me, this is one of the most fascinating stories about exercise and the gut microbiome, that it's been found that both in mice and in humans, that some people have a particular taxa, a microbial type of microbe called Veillonella. And these microbes can take up lactic acid that's produced, you know, with strenuous exercise by your muscles. That's what gives you the aches and pains on the day after, you know, you do a long strenuous exercise. So this particular strain of microbes that's present just in some individuals can pick up these lactase molecules, and transforms them into short-chain fatty acids, which are then fuel that's being absorbed from the gut and goes to the liver and gives these people an extra boost of energy, so they can run longer and faster, because the microbes have learned to turn something that's in most people has a negative effect into a positive. So it shows you how closely interconnected we are with, you know, with some of these microbial functions. And we're just really at the beginning of understanding this. I always want to emphasize, like what I tell you today, if you interviewed me in 10 years from now, you know, it would sound ridiculous, most likely. So we're at an early stage of this, and I think we'll, one thing you can say for sure, that there will be a lot more health relevant information that will come out of this, and it will provide a continuous boost on the scientific interest of healthy diets. I think that's pretty clear to me.
Well, I hope I get to interview you in another 10 years or preferably sooner when your new book comes out. I just want to circle back a minute to the coffee and alcohol question, because I don't partake in either. I mean, a person still could have good GI health they don't have to include these in their diets. They're not essential.
No, they're not essential. They're definitely not essential.
Great.
And as I said, I mean, it's hard to say. I mean, the Mediterranean diet as a package clearly is unequivocally good for you. But which of the components are the most important? Is it the polyphenols? Is it the fiber? Is it the combination of polyphenols and fiber? And what role do these social dimensions play? And I think wine definitely, or alcohol, unless you're an alcoholic, you know, always has the social dimension. People drink in bars, drink at parties, drink at weddings. So they're so closely tied together that I think it would be hard to really separate that out. If you did an experiment and just give people, you know, test people drinking 5 glasses of wine for a week and compare them that don't do that, that wouldn't give you the whole answer. If those 5 glasses of wine are consumed with close friends and family, they probably would have a totally different effect on your health than in the laboratory and just, gulping down just like water. I think that's
right. Well, I know that Sardinia is one of the blue zones, but so is Loma Linda, and they consume neither alcohol or coffee, but they have, like you say, the great social interactions, and they do share meals and things like that.
Yeah, maybe the social interaction trumps, and Europeans have just learned to closely tie those together. It's, I just, speaking from personal experience, having grown up in Bavaria, one of the beer drinking, hubs of the world. I mean, nobody sits at home and consumes the beer in front of the television. You go out into a place and meet with your friends and have all summer long these festivals. So, yeah, I would not be surprised if the benefit that comes from moderate alcohol consumption is really the benefit that people get from the social interactions, and that you may get the same benefit you have the social interactions without the alcohol. I think it's quite possible.
Right. How does our emotional state affect how food is processed by our gut?
In a big way. That's the whole thing about the brain-gut microbiome axis. That so we know that stress has a major. We talked about this earlier. It's stress by activating the autonomic nervous system, sends these signals directly down to the gut. We know a lot about what it changes in the gut. We know also how it affects the microbial behavior. And so many of these negative mood states, like anxiety and anger, also turn on the stress system within the brain. They're always linked to that. And so even though we don't have really good studies on that, except for studies in mice, but in mice you can't really study anger, you can study anxiety. They definitely, those negative mood states, I would make an intelligent speculation that they have a very profound effect on your microbial makeup and how food is processed. If you're in a stress state, you will process the food very different, or in an anxious state or an angry state. And some people know this. So if you're angry and you eat something, you're much more likely to get a stomach ache than if you're relaxed. It's with positive emotions. That's an interesting question. And it's generally in medical science, we don't get funded for studying positive things. It's always disease and negative things. So there's very few studies on that. My colleague Kirsten Tillich has done a study with a mindfulness-based stress reduction intervention in IBS patients, and has looked at their microbiome and their overall well-being and their brain changes. And there seems to be a connection, but I think it would be too early to say. For example, a regular meditator, would they have a different gut microbial composition? I have to say, having attended and being invited to a conference of the European Mind Life Institute last year, and just walking into this audience, interacting with the attending people for 3 days, was an amazing experience. Like, you go in as a stressed out person jumping off the plane, and then all of a sudden you immersed in this, in this mindful sea of individuals, and something happens to you. Your body, your body changes. And at this meeting, there was also a big emphasis on vegetarian foods. So it was a combination of those. I don't know what played a bigger role, but I'm sure at this conference, the combination of what people talked about, and particularly how people interacted with each other in this mindfulness way, had a profound effect on people's digestive systems as well. So, certainly nobody came up to me and asked me any questions about IBS in this audience, which is unusual.
We could talk a lot about IBS. That is one of those things that so many people are struggling with. How does sugar, what do you feel about sugar for our health in general and for our microbiome and gut health in particular?
Yeah, so, sugar, so refined carbohydrates. I mean, this is always sort of, people mix this up. Say, carbs are bad for us. That's really not the case, because complex carbohydrates are exactly what makes up fiber and what's the food for the microbes. It's really the refined sugars that you have a very high caloric, calorie dense food that our intestine is not designed for. Our endocrine system is not designed for. I mean, there are studies that you get negative changes on the gut microbial metabolites with with high sugar. This is also shown in animals, and but also surprisingly, this whole trend for a while to use sugar substitutes does not change that picture. So for some reason, and it's too long a story to get into this now, it has the same detrimental effect on, so any of these artificial sweeteners have the same detrimental effect. And if you combine the sugar, so if you continue to eat a high sugar diet with these artificial sweeteners, it's twice as bad. So sugars I mean, you're an expert in making delicious desserts with minimal,
Just fruit. I don't use sugar or flour. I just use the fruit, the whole fruit, and nothing but the whole fruit.
Yeah, and there's something about this. So obviously there's a lot of sugar in fruit as well, but in fruit it's combined with undigestible carbohydrates. So the absorption pattern is very different. It's similar sugar molecules, but the absorption pattern is very different. It's slower. It empties the stomach slower. It goes through the intestine slower. You don't get the same insulin spikes and glucose spikes. So yeah, if you have a sweet tooth, I think refined sugar in a bag or in a sugar cube is definitely something should not be in your kitchen. But providing sweetness in natural means, as I mean, this is the whole reason that we have genetically an affinity for sweet things, because in evolution our ancestors were looking for these fruits which were not in the abundance that we have them now. It was a big thing to find one. And if you found one, you would want to see, is there more? And you would eat several of these, fruit items. So, yeah, definitely, stay away from refined sugar under any circumstances. And that includes sweetened drinks. People think if they avoid putting sugar in their coffee, but, gobble down Diet Coke or Diet Pepsi, they're doing a good thing. I'm still shocked in our, noon lectures, in our divisional meetings at UCLA. So the most popular drinks are the Diet Coke and Diet Pepsis of all the faculty. I mean, and there've been so many papers written on this, that how detrimental that is for some people in the public space. Brag about, that they survive on 10 Diet Pepsis a day. It's kind of interesting how this mindset is ingrained and being associated with being cool or health-minded, or it's really getting away from this craving from sugar. You know, it's once you train yourself not to use refined sugar in your meals and in your drinks, you don't really crave for it anymore. You know, it just changes the way that your system values sugar. You know, the salience of sugar, of sweetness goes way down.
Yeah, that's so true. I find that to be really true for myself as a recovering sugar addict. And I'm so happy you said that these sugar alcohols like mannitol, sorbitol, xylitol, erythritol, and stevia, they're equally bad for us because, and from a culinary standpoint, I think they taste terrible.
Yeah. I mean, some people don't notice that, you know, and, you know, looking back, I was one of those people myself for a while. I thought, oh, it's just the best thing, you know, and had my 5 cups of coffee with artificial sweeteners, and not realizing what I was doing. You know, I was hooked on the sweetness, not on the coffee, really. So it's an interesting, for me, it's been an interesting journey. You know, having, as I said earlier, grown up in a business where sweets were ubiquitous and viewed as, you know, a way of making, you know, running a business, then becoming a gastroenterologist, becoming completely agnostic to health related, to diet in general. And then having gotten back into this, really in the footsteps of my book, or like around that time when I published that, and then realizing how much knowledge and education can help you to, you know, I mean, first of all, to realize all the things that you have not done right up to now, but also how easy it is to do the right thing. It's really not it's not rocket science. Rocket science is what scientists have done, like in the microbiome field. You know, if you look at people, the kind of science that's being done there now is mind-boggling. But the consequence, the lessons we learn from that is not rocket science. It's very easy, simple dietary and lifestyle modifications.
Okay, that's great, because the next question was for you to tell us what those are, because people hear about certain foods to eat or supplements to take or behaviors to engage in to optimize their brain health or their bone health or their cardiovascular health, but very little is said about what we can do to optimize our gut health. So what should we be doing on a daily basis to do that?
So this is now coming back to many of the topics that we touched upon during this conversation. You know, it's the combination of regular daily exercise, not excessive, because we know that has a negative effect on our health. A largely plant-based diet in moderate amounts, which will happen automatically because there's none of these foods with high caloric densities in that kind of a diet that you would get otherwise. It's practicing a mindful state, decreasing your stress level and your anxiety level. And yeah, I would say with these three arms, you know, the mind, your body and your muscular system, training your cardiovascular system at a high level, and a healthy diet, that's what I mentioned is the easy way to actually accomplish this. The motivation for doing that's a harder thing in our modern lifestyles. Possibly, you know, one good thing about this current social isolation or slowdown in society is that people possibly, I don't know if that's actually happening, had more time to do these things rather than spending 2 or 3 hours commuting every day. Yeah, I mean, I think this has to be, to create the motivation to practice a lifestyle like this requires primarily an educational process. You know, it's if you don't understand why these things work, you're probably unlikely to have the motivation to pursue it. You'll do it for a couple of weeks and then say, okay, I don't want to, you know, I love my sweets, I love my hamburgers, But once your mindset gets altered, like you're reprogrammed almost at your brain level, then this will become your default mode. And I think that's a very important component. These short-term, these diets, lose weight in 2 weeks or whatever that's promoted, a terrible way what you can do to your gut health, because we know this, the dieting, the yo-yo effect, which involves the microbes as well. If you switch after this, short-term fasting back to the old diet, you will overshoot your original weight. And the microbes apparently generate a memory of that, and every time you do it, it gets worse. So changing lifestyles has to become a permanent mindset. It's not any of the fat diets, forget about it. Don't. I should mention one thing we didn't touch upon, which is a very important, I would say, rediscovery of ancient wisdoms, and that has to do with this time-restricted eating. Some people call it intermittent fasting or fasting mimicking diets. So our ancestors never had access to the abundance, ubiquitousness of food that we have today. So for probably most hours of the day, they did not have access to food, sometimes for several days in a week. So this was part of our ancestral lifestyle and eating. Then many religions and cultural traditions around the world have also incorporated intermittent fasting as a religious or spiritual entity, probably not by coincidence. That it's developed a religious meaning, but it's the origin probably is somewhere else. And then the last, I would say, couple of decades, people have done lots of mouse studies that have shown that restriction of diet, calorie restriction, will have a positive effect on longevity. And this has hit the mainstream in humans now with various paradigms of time-restricted eating. And that goes from, the 16-8 split, that for 16 hours you leave your gut empty. For 8 hours, you can eat pretty much anything you want. That has had remarkable successes, in counteracting all the metabolic consequences, weight gain. Some people say, it also lifts their brain fog. And surprisingly, also, we know now that this involves the microbes as well, because if you fast, your microbes move away from being in contact with your intestinal layer, with the immune system. So they move away from it. When you eat, they move back closer to it, and they stimulate the immune system more. So what you do during these 16 hours, you remove the direct stimulation of your immune system for a prolonged period of time during the day. I'm sure there's other mechanisms for that as well, but so adding this to the Mediterranean diet is probably right now, I would say, the best recommendation that you can give, and it's feasible. Generally dieting is not a good idea because you always come back to catch up with it, but something that you can make a part of your regular lifestyle, I think that's that you should do.
If our microbiome is so important and our brain is always communicating with our gut, people that have had gastric bypass, how are they affected? Because you're actually cutting out their microbiome.
Yeah, so that's, the whole gastric bypass surgery, we've done doing some research in this area. We don't know exactly why this is the only effective for morbidly obese people, the only effective long-lasting therapy, even though it completely, alters your gastrointestinal anatomy and physiology. We don't know exactly the mechanism. It's not it's not that it's harder to eat the same amount. There's something else that kicks in almost right after the surgery that affects your insulin sensitivity. And we don't know exactly what that signal is and to what degree. It also seems to be involving the gut microbes because they are altered after that surgery. And in animal models, people have shown that if you transplant fecal material from a patient after it had lost like 60 pounds after the surgery into an obese mouse, that mouse will lose weight as well. So there's something that the microbes play a role in this, mediating the weight loss, but we don't know exactly what it is. So it's definitely not something I would recommend unless somebody is morbidly obese and risks dying from a heart attack or some other complication. The intermittent fasting in people like that is probably the way to go, I would say today. It's
Sounds good. And I think for most people, it's doable. This has just been so wonderful talking to you. Dr. Meyer, what is the truth about GI health?
So the truth about GI health is that, and using the common word gut health, is that it's a lot more than dealing with the gut. It's dealing with your overall health, every organ. It's a key determinant of your overall health. And it's something that you can easily manipulate and influence by some of the things that we talked about today, primarily by a healthy diet and a lifestyle that incorporates other factors that influence gut health, like your mind and exercise, in addition to the dietary changes. So gut health has become one of the central themes, I would say, of the health debate in general. And gut health is also closely linked, I would say, to the One Health concept, that it affects or is related to every other aspect of health, all the way up to planetary health.
Beautifully said. Thank you so much.
Okay, good talking to you, AJ, as always.
I love Dr. Herrenmeyer. I've interviewed him before and he is just a delight. And it's so interesting how he almost became a chocolatier. He mentioned he was from Bavaria and that was the family business. And now he is a proponent that's completely against sugar, real or fake. So many great takeaways from him. I'll start with how he talked about that the gut is just not our gut. It's the immune system. It's the enteric nervous system. It's the endocrine system. They're all in the gut and they interact with each other and they cannot be understood in isolation. The microbes in the gut interact with the immune system and what we feed them influences their behavior. And as we heard from the psychiatrist, Dr. Uma Naidoo, the neurotransmitters, they are produced in the gut. 70%, I believe, of serotonin, in fact, she said. And the health of the ecosystem of the gut is determined by diversity. And as Dr. Tillage said, the diversity of the number of plants we eat, even the diversity of the exercise we do. It's fascinating, isn't it? And like all the other speakers, he promotes a predominantly plant-based diet, which can be an exclusively plant-based diet. You'll hear from many of our speakers, because he says this is what our genetic makeup is adapted to. We're not adapted to being eating the carnivore diet or the keto diet or the paleo diet the way it's taught today, that's for sure. And that, again, fiber is the key. And it seems like every speaker mentions these short chain fatty acids. These are the foods for our microbes. And where do you get them? From fiber. And if all you're eating is animal products and processed food, well, you're not getting fiber. So, and we know that only 3% of Americans are getting enough fiber. Really interesting how he talked about how animal fats give us bile acids that actually cause degeneration and inflammation in the brain. And, he's a GI doctor, but he knows this. And That's why one of the many reasons we recommend avoiding animal products, but particularly dairy. I could hug him and kiss him when he said that dairy is not human food and that we lose the enzyme that breaks down lactose. And that medicine has made this a disease entity and a diagnosis. There's no such thing as lactose intolerance because we're not supposed to even drink milk. He said milk is not made for adult human consumption. And I believe that Dr. Clapper is going to talk about that tomorrow as well. Like Dr. Tillich and Dr. Chang said, chronic stress can damage the microbiome as much as an unhealthy diet. So if you have an unhealthy diet and stress, it is magnified and amplified. And he concurred that exercise favorably affects the gut microbiome, but that extreme exercise actually has the opposite effect. And that when we process food differently, we experience negative, when we experience negative emotions like anger, we actually process our food differently, which is why they were saying, don't eat when you're stressed, don't eat when you're angry, don't eat when you're upset. And he said complex carbohydrates are the foods for humans and it's the food for our microbiomes, and that's what we should be eating. Carbs are not the enemy, maybe refined carbs like sugar and flour and alcohol, but complex carbohydrates, this is what our microbes eat. And he said that sugar is bad for the gut. This is someone who almost had a career using it as an occupation, but he said the artificial sweeteners are even worse. And probably interviewed 50 GI doctors now, every single one concurs that sugar is terrible for the gut, but that the sugar alcohols, erythritol, xylitol, mannitol, sorbitol, and stevia and aspartame, these are even worse. These are a nightmare from your microbiome. Stay away from refined sugar under any circumstances, is what Dr. Meyer says. And it was funny how Diet Coke is the most popular drink at his faculty meetings. Now, I'm sure he's not drinking it. And he says, if you want to, and Dr. Fuhrman talks about this a lot, and I believe he will on the summit, if you want to get away from the cravings, then stop eating it, stop using it. You can train yourself not to crave it, not to desire it. And that what he recommends for what is the truth about GI health, eat a plant-based diet or primarily plant-based diet, because he explained that none of these foods have a high caloric density, stress reduction, moderate exercise. And that what's good for you is good for your microbes. He said, forget about fad diets and the keto and the carnivore diet. These are going to mortgage your health in the long term, and they're going to mess your microbiome up for a very, very long time. He talked about how it's hard to motivate people often, but that a lifestyle change, it has to become a permanent mindset, because dieting is never a good idea, especially these fad diets. And that he talked about ancient wisdoms like Kirsten Tillich, her ancient wisdoms that she recommended were Tai Chi and yoga. And one of the ancient wisdoms that he recommended, that many of the speakers on the summit, like Dr. Goldhammer, recommend, is a 16 8-hour window of intermittent fasting for 16 hours, feeding for 8 hours. This is not only good for longevity and weight loss, but he explained how when you fast, you remove the direct stimulation of your immune system. And he talked about how the microbes react when you're feeding versus when you're fasting. So I think he is a wonderful, wonderful speaker, a wonderful person. I was so honored to have him on the summit. And I'm honored that you guys are taking the time out of your busy days to listen to this and hopefully share this with your friends. It's absolutely free for 9 days. We're on day 2 today, and you can choose to own the summit package for life and listen as much as you want. Watch, get the downloads of the audios, videos, even a written transcript, which I find can be very helpful when you're looking up nuggets of information that you forgot. And you even get a buddy pass. What a great holiday gift it might make for someone. So tomorrow I'd like to introduce the 4 wonderful speakers who will be talking about what happens when GI problems turn into diseases. We start the day with the beloved Michael Clapper, who talks about leaky gut, what causes this often undiagnosed problem. Lori Wellstead is a registered dietitian who actually has celiac disease, which is going to talk, and she's going to talk at length about the celiac disease, why it's very common actually in some people and how it can sneak up on us, and what you need to know about it if you think you might have it, because the symptoms are unbelievably varied. And she'll also talk about gluten, whether or not we should be avoiding it if we don't have celiac disease. We have Shamiz Kachwala. He has a success story that will blow your mind, healing from a very, very serious GI disease, ulcerative colitis. and he's going to tell you the truth about carbs, and he's going to give you a dietary protocol that's going to promote recovery from this disease that may even help out with other GI diseases. And we end the day with Dr. Ron Weiss, who is not only a doctor, but a regenerative farmer. And he'll talk about the hidden link, how our environment and food sources actually change our microbiome. You're not going to believe that the foods we choose, even sometimes organically, can change our gut microbiome. So thank you so much for being here. Thank you for the kind emails and for the kind comments that you're making on the summit page. And again, please share this summit with your friends, family, realizing that you don't have to have gut problems to glean the knowledge you're getting from these speakers, because all disease begins and ends with the guts. Have a wonderful rest of your day, and we'll see you here bright and early, 8 a.m. Pacific time, 11 a.m. Eastern time tomorrow for a wonderful day 3. Take care.